Good afternoon all. Welcome to 2026 Medical Coding Updation webinar conducted by Arown Academy. Before moving on to the session, I would like to introduce myself. I am Kirtana. I am a certified professional coder and medical coding faculty of Arown Academy. I will be hosting today's session. Arown Academy, കേരളത്തിലെ one of the best AAPC approved healthcare training instituteകളിൽ ഒന്നാണ്. Established in 2016. And the organization has 6 branches throughout Kerala. Online and offline പ്ലാറ്റ്ഫോമുകളിലായി മെഡിക്കൽ കോഡിംഗ്, മെഡിക്കൽ സ്ക്രൈബിംഗ്, ഹോം ഹെൽത്ത് കോഡിംഗ്, IPDRG കോഡിംഗ്, ഹോസ്പിറ്റൽ അഡ്മിനിസ്ട്രേഷൻ തുടങ്ങി നിരവധി ജോലി സാധ്യതയുള്ള കോഴ്സുകൾ പ്രൊവൈഡ് ചെയ്യുന്നതോടൊപ്പം 100% പ്ലേസ്മെന്റ് അസിസ്റ്റൻസ് കൂടെ നൽകുന്നു എന്നത് ആരോൺ അക്കാഡമിയുടെ ഒരു പ്രത്യേകതയാണ്. മെഡിക്കൽ കോഡിംഗ് അപ്ഡേഷൻസുമായി ബന്ധപ്പെട്ട് ഇയർലി അപ്ഡേഷൻ വെബിനാറുകൾ ആരോൺ അക്കാഡമി കണ്ടക്ട് ചെയ്യാറുണ്ട്. ഇന്നത്തെ ഈ വെബിനാർ സെഷനിൽ ജോയിൻ ചെയ്തിട്ടുള്ള എല്ലാവരും തന്നെ മെഡിക്കൽ കോഡേഴ്സ് ആൻഡ് മെഡിക്കൽ കോഡിംഗ് സ്റ്റുഡൻസ് ആയിരിക്കും. ആസ് വി ഓൾ നോ, ഇയർലി അപ്ഡേഷൻസ് നടക്കുന്നുണ്ട് ആൻഡ് ഈ അപ്ഡേഷൻസ് അറിഞ്ഞിരിക്കുക എന്നത് ആസ് എ കോഡർ നമ്മുടെ റെസ്പോൺസിബിലിറ്റിയാണ്. അതിന് നിങ്ങളെ ഹെൽപ്പ് ചെയ്യുക എന്നതാണ് ഇന്നത്തെ ഈ വെബിനാർ സെഷന്റെ ഉദ്ദേശം. ആൻഡ് ബിഫോർ വി ബിഗിൻ, I would like to introduce our faculties, those who will be conducting today's session. Dr. Namita Prasad, BDS graduate. Dr. Reshmi M. Ramachandran, BAMS graduate. Dr. Geetu Soman, BAMS graduate. Dr. Sakya CM, BHMS graduate. Dr. Adila Shirin P, BHMS graduate. A warm welcome to each one of you to the session. And now, I would like to introduce a very special person of our academy, Ms. Ashwati Raj, Academic Head of Arown Academy. Ma'am, welcome. Welcome to the session.
Okay, thank you, ma'am. Okay, hi all. Good afternoon. So, നമ്മളുടെ 2026 നമ്മുടെ ICD-CPT updation ആണ്. അപ്ഡേറ്റ്സിന്റെ ക്ലാസ്സസ് ആണ് നമുക്ക് ഇന്ന് വന്നിട്ടുള്ളത്. സോ രണ്ട് കാര്യങ്ങൾ ഒന്ന് ഫസ്റ്റ് പറയാൻ വേണ്ടിയിട്ടാണ് ജോയിൻ ചെയ്തിരിക്കുന്നത്. ഫസ്റ്റ് നിങ്ങളുടെ കയ്യിൽ ഒരു നോട്ട് ഉണ്ടായിരിക്കണം. നമ്മളിപ്പോൾ ലൈവായിട്ട് പഠിച്ചുകൊണ്ടിരിക്കുന്ന സ്റ്റുഡൻസും ഉണ്ട്, കഴിഞ്ഞവരും നിങ്ങൾ ജോയിൻ ആയിട്ടുണ്ട്. സോ തീർച്ചയായിട്ടും നിങ്ങളുടെ കയ്യിൽ ഒരു നോട്ട് ഉണ്ടായിരിക്കണം, പെൻ ഉണ്ടായിരിക്കണം. നിങ്ങൾ നോട്ട് ചെയ്യുന്നതെല്ലാം പോയിന്റ് ആയിട്ട് നോട്ട് ചെയ്തെടുക്കുക അവിടെ. അതേപോലെ തന്നെ നിങ്ങൾക്ക് ഈ ഒരു സെഷൻ നമുക്ക് ലൈവ് സ്ട്രീമിംഗ് ആയിട്ട് യൂട്യൂബിൽ നമ്മൾ പോകുന്നുണ്ടായിരിക്കും. ഇൻകേസ് ആർക്കെങ്കിലും റീജോയിൻ ചെയ്യാൻ പറ്റുന്നില്ല, അല്ലെങ്കിൽ കട്ടായി പോയിട്ട് ആർക്കെങ്കിലും റീജോയിൻ ചെയ്യാൻ പറ്റുന്നില്ല എന്നുണ്ടെങ്കിൽ നിങ്ങൾക്ക് തീർച്ചയായിട്ടും യൂട്യൂബിൽ നിങ്ങൾക്ക് കണക്ട് ചെയ്യാൻ പറ്റുന്നതായിരിക്കും. ആൻഡ് നിങ്ങളുടെ ഫ്രണ്ട്സിന് ആർക്കെങ്കിലും ജോയിൻ ചെയ്യാൻ പറ്റുന്നില്ല എന്നുള്ള ഒരു സാഹചര്യം ഉണ്ടെങ്കിൽ തീർച്ചയായിട്ടും നിങ്ങൾക്ക് ലൈവ് സ്ട്രീം അറ്റൻഡ് ചെയ്യാൻ പറ്റുന്നതാണ്. ഓക്കെ, ആൻഡ് ഇതിന്റെ നോട്ടുകൾ നമ്മളുടെ ആരോണിൽ കറന്റ് ആയിട്ട് പഠിച്ചുകൊണ്ടിരിക്കുന്ന സ്റ്റഡി ചെയ്യുന്ന സ്റ്റുഡൻസിന് നിങ്ങളുടെ ആപ്പിൽ അവൈലബിൾ ആയിരിക്കും. ആൻഡ് ബാക്കിയുള്ളവർക്ക് നിങ്ങൾക്ക് എന്ത് ചെയ്യാം, യൂട്യൂബിൽ നിങ്ങൾക്ക് ആ ഒരു റെക്കോർഡിങ്സ് അവിടെ ഉണ്ടായിരിക്കും, നിങ്ങൾക്ക് അതിൽ സെർച്ച് ചെയ്യാവുന്നതാണ്. സോ അപ്പോൾ ഓൾ ദ ബെസ്റ്റ്, എല്ലാവരും കറക്റ്റ് ആയിട്ട് എടുക്കുക. നിങ്ങൾക്ക് ഇതിലുള്ള ഡൗട്ട് ക്ലിയറിംഗ് സെഷൻസ് ഉണ്ടായിരിക്കും. സോ ഇപ്പോൾ ഡൗട്ട് ക്ലിയറിംഗ് ഉണ്ടെന്നുണ്ടെങ്കിൽ നിങ്ങൾക്ക് എന്ത് ചെയ്യാം, യൂട്യൂബിൽ നിങ്ങൾക്ക് അതിൽ കമന്റ് ചെയ്ത് ചോദിക്കാവുന്നതാണ്. നമുക്ക് അവിടെ തന്നെ നമുക്ക് ക്ലിയർ ചെയ്ത് തരുന്നതായിരിക്കും. ഓക്കെ, താങ്ക് യു.
Thank you so much, ma'am. Moving on with the session, let's see what are the updates that have come in 2026. The updation regarding ICD chapter 1 to 14 will be taken by Dr. Namita. Over to you, ma'am.
നമിത മാമിന്റെ വോയിസ് ബ്രേക്ക് ആണ്, വോയിസ് ഇല്ല, കട്ടാണ്. ഹോസ്റ്റ് ഒന്ന് കോ-ഹോസ്റ്റ് ചെയ്യണേ. കണക്ഷൻ വോയിസ് ഇല്ല, ഒന്ന് വെയിറ്റ് ചെയ്യണേ. ഓക്കെ, ഇപ്പൊ ഒന്ന് സംസാരിക്കും.
Hi.
Yes, fine.
I'm Dr. Namita, BDS graduate ആണ്. Currently working as a Arown faculty as an online firm. So ICD updation ആണ്. We'll move on to ICD updation. PDF share ആവുന്നുണ്ടെന്ന് വിചാരിക്കണം. Yes. Yeah.
Yes.
So moving to ICD updation in 2026. First, we have 487 new codes in 2026 updation and 38 revised codes and 28 deleted codes. So totally in 2025 ICD-10 there was 74,260 codes and now it's 74,719 codes. And moving to updation, it's about punctuation. Commas as are used in alphabetic index and have different meanings based on the context of the index entry, including alternate verbiage, modifier essential and non-essential, alternative, for and or. Example, diabetes, type 2, it's type 2 diabetes. Alternate verbiage ആണ് അല്ലെങ്കിൽ essential modifier ആയിട്ടാണ് യൂസ് ചെയ്യുന്നത്. Then it's obstruction, obstructed. In that comma refer to or. And moving on to multiple sites updation. The classification defines multiple as involving 2 or more sites. Follow chapter-specific guidelines for assigning codes for multiple sites. In the absence of chapter-specific guidelines, assign codes describing specified sites individually. And we'll learn more about multiple sites in muscular chapter. And moving on to chapter. First, chapter 1, certain infectious and parasitic disease. That we have 2 new codes and 1 deleted codes and 0 revised codes. The 1 deleted code is B88.0, other acariasis. Acariasis is an infestation of human or animal tissue by mites or tiny objects. So we have new codes in B88 category, that is B88.01, that is infestation by Demodex mites. That is actually hair follicles ഉണ്ടാകുന്ന tiny mites ആണ് അതിന്റെ infestation ആണ് B88.01. And B88.0 എന്ന് പറഞ്ഞ deleted code other acariasis ഇപ്പൊ updated ആയിട്ട് B88.09 other acariasis എന്നായിട്ടുണ്ട്. And we have no revised codes. And moving on to guidelines in this chapter, we have updation about HIV follow-up. When a patient present for follow-up regarding the HIV test and the test result is negative, assign code set 71.7 HIV counseling code. Before only screening ആയിരുന്നു നമുക്ക് guidelines ഉണ്ടായിരുന്നത്. Now we have if patient follow-upന് വന്ന് HIV test ചെയ്ത് test negative ആണെങ്കിൽ we have to assign code set 71.7, that's HIV counseling code. And another one, if a patient with documented HIV positive status is currently managed on antiretroviral medication, assign code set21 asymptomatic HIV in the absence of any additional documentation of HIV disease, HIV related illness or AIDS. AIDS അല്ലെങ്കിൽ HIV related illness condition പറഞ്ഞിട്ടില്ല, HIV positive status മാത്രമാണ് and they are currently managed on antiretroviral medication ആണെങ്കിൽ we have to assign code set21, that is asymptomatic HIV. And moving on to chapter 2, neoplasm, we have 3 new codes that's in C50 category and we don't have any deleted or revised codes. C50 category is malignant inflammatory neoplasm of breast. We don't have code before. So C50.A0 is malignant inflammatory neoplasm of unspecified breast, right or left, specify cheyidilla. And C50A1 is malignant inflammatory neoplasm of right breast. C50A2 is malignant inflammatory neoplasm of left breast. Malignant inflammatory neoplasm is a rare aggressive breast cancer. And moving on to guidelines change. If a patient admission or encounter is chiefly for the administration of chemotherapy, immunotherapy, or external beam radiation therapy for the treatment of neoplasm, assign code set 51.0 encounter for anti-neoplastic radiation therapy or set 51.11 encounter for anti-neoplastic chemotherapy or set 51.12 encounter for anti-neoplastic immunotherapy as a first listed or principal diagnosis. The previously guideline. The change is if the reason for admission is more than one type of anti-neoplastic therapy, can code set 51.0 and code from subcategory set 51.1 code be assigned together one of these code as secondary code. Previously, the same admission എന്നാണ് മെൻഷൻ ചെയ്തിട്ടുണ്ടായിരുന്നത്. ഇപ്പോൾ the reason for admission എന്ന രീതിയിലേക്ക് ചേഞ്ച് വന്നിട്ടുണ്ട്. And moving to chapter 3, disease of blood and blood forming organs, D50 to D89 category. We have 3 new codes, 1 deleted code, revised code is 0 and no guideline changes. Deleted code is D71 and we have new 3 codes in D71 category. D71 previously ഉണ്ടായിരുന്നത് functional disorders of polymorphonuclear neutrophils ആയിരുന്നു. And we have D71.1 new code is leukocyte adhesion deficiency and D71.8 is other functional disorders of polymorphonuclear neutrophils and previously ഉണ്ടായിരുന്ന functional disorders of polymorphonuclear neutrophils. Now it's D71.9 code ആയിരിക്കും. Moving on to chapter 4, endocrine, nutritional and neurodevelopment disease, E00 to E89 category. 23 new codes are there, 3 deleted codes, no revised codes and no guideline changes. And moving on to chapter 5, mental, behavioral and metabolic disease, F01 to F99 category. We don't have any updation, no new code, no deleted code, no revised and no changes in guidelines. Next, chapter 6, disease of nervous system, G00 to G99 category. We have 10 new codes. First one, G31.87, primary progressive apraxia of speech. Apraxia of speech is a neurological speech disorder. So we have a new code about apraxia of speech. And next category is G35 category. We have new code. Before we have G35 code was that is now it's deleted. It's multiple sclerosis G35 and now G35 category codes വന്നിട്ടുണ്ട്. It's about types of multiple sclerosis. എത്ര ടൈപ്സ് ഉണ്ടോ അതിന്റെ കോഡ്സ് ഇപ്പോൾ പുതിയതായിട്ട് അപ്ഡേഷൻ വന്നിട്ടുണ്ട്. G35.A is relapsing remitting multiple sclerosis. G35.B0 is primary progressive multiple sclerosis unspecified. G35.B1 active primary progressive multiple sclerosis. G35.B2 non-active primary progressive multiple sclerosis. G35.C0 secondary progressive multiple sclerosis unspecified. G35.C1 active secondary progressive multiple sclerosis. G35.C2 non-active secondary progressive multiple sclerosis and G35.D multiple sclerosis unspecified. Those are types of multiple sclerosis. And another code is G71.036 limb girdle muscular dystrophy due to fucotin related protein dysfunction ആണ് new code ആണത്. And moving on to chapter 7, disease of eye and atnesia, H00 to H59 category. We have 1 deleted code and 16 new codes. The deleted code is H01.8, that is other specified inflammations of eyelid. And we have new codes under H01.8 category. That is first one, H01.81, other specified inflammation of right upper eyelid. H01.82, other specified inflammation of right lower eyelid. H01.83, other specified inflammation of right eye. Unspecified eyelid ആണ്, upper ആണോ lower ആണോ എന്ന് documented ചെയ്തിട്ടില്ല. Then H01.84, other specified inflammation of left upper eyelid. H01.85, other specified inflammation of left lower eyelid. H01.86, other specified inflammation of left eye. Upper ആണോ lower ആണോ എന്ന് documentation ഇല്ല, unspecified eyelid ആണ്. H01.89, other specified inflammation of unspecified eye ആണ് and unspecified eyelid ആണ്. Then H01.8A, other specified inflammation of right eye, upper and lower eyelid, both eyelids ആണ്. H01.8B, other specified inflammation of left eye, upper and lower eyelids. And next one, same chapter, H05.831, thyroid orbitopathy, right orbit, new code ആണ്. H05.832 thyroid orbitopathy, left orbit. H05.833 thyroid orbitopathy, bilateral, both right and left. H05.839 thyroid orbitopathy, unspecified orbit. Thyroid disease, hyperthyroids, mainly Graves' disease associated eye disorder, thyroid orbitopathy. And another new codes under neovascular secondary ankle closure glaucoma, diabetic retinopathy pola condition karanam secondary aayittu varuna glaucoma. Then H40.841 neovascular secondary ankle closure glaucoma, right eye. H40.842 neovascular secondary ankle closure glaucoma, left eye. H40.843 neovascular secondary ankle closure glaucoma, bilateral, both right and left. H40.849 neovascular secondary ankle closure glaucoma, unspecified eye, right ano, left ano in the documentation illa. And moving on to chapter 8, diseases of ear and mastoid process, H60 to H95 category, we don't have any changes. And next chapter 9, disease of circulatory system, I00 to I99 category. Hypertension with heart disease, hypertension with heart conditions classified to I50 heart failure, I51.4 myocarditis, unspecified, I51.89 other ill-defined heart diseases, and I51.9 heart disease, unspecified, is assigned to code from category I11 to hypertensive heart disease. I11 category, hypertensive heart disease related condition, heart conditions are codes. Use additional codes or codes from category I50 heart failure or I51 complication and ill-defined description of heart disease to identify the heart condition. Previously I50 category മാത്രമായിരുന്നു additional code mention ചെയ്തിട്ടുണ്ടായിരുന്നത്. ഇപ്പോൾ I51 category കൂടി additional code ആയിട്ട് mention ചെയ്തിട്ടുണ്ട്, except two code in I51 category. Hypertension with heart condition classified to I51.5 myocardial degeneration or I51.7 cardiomegaly is assigned to code from category I11 hypertensive heart disease. No additional code is assigned to identify the specific heart condition. I50 category, I51 category, additional code I11 category in the code add cheyam, but except two codes I51.5 and I51.7 codes additional code mention cheyanda. And the same heart condition I50 to I51.4, I51.7 category, I51.89, I51.9 with hypertension are coded separately if the provider has documented they are unrelated to the hypertension. The applicable hypertension code I10 essential or primary hypertension or a code from category I15 secondary hypertension should be assigned sequence according to the circumstances of the admission or encounter. Either related alla I50 category, I11 category in Tamil relation illa engil, we have to code separately, and our time I10 category ano, I15 category ano in the nokita code cheyga. And we have new codes in circulatory system, that is I27 category codes. I27.840 Fontan associated liver disease, I27.841 Fontan associated lymphatic dysfunction, and I27.848 other Fontan associated condition, I27.849 Fontan related circulation, unspecified. Fontan in the paranada or operation specially performed in children with single verticular heart defect ഉള്ള കുട്ടികൾക്ക് കൊടുക്കുന്ന ട്രീറ്റ്മെന്റ് ആണ്. അതുമായി റിലേറ്റഡ് ആയിട്ടുള്ള ഡിസീസസിന്റെ കോഡ്സ് ആണ് ന്യൂ കോഡായിട്ട് വന്നിട്ടുള്ളത്. And chapter 10, diseases of respiratory system, J00 to J99, we don't have any changes. Moving on to chapter 11, here also same, we don't have any changes. The diseases of digestive system, K00 to K95. And next chapter, chapter 12, diseases of skin and subcutaneous tissue, L00 to L99 category. ICD Koshadhigam updation new codes or chapter ana 116 codes addition under revision 2 ana deletion 0. And now we have flag specific infection code new codes ആയിട്ട് വന്നിട്ടുണ്ട്. 4 new codes, that is L02.217, L02.227, L03.31A, L03.32A. Flank means lumbar region ആണ് flank എന്ന് ഉദ്ദേശിക്കുന്നത്. So that site specific ആയിട്ടുള്ള codes 4 new codes വന്നിട്ടുണ്ട്. And we have new codes in the category of non-pressure chronic ulcer codes. New anatomical sites added ആയിട്ടുണ്ട്. Abdomen, chest, neck, face, groin, upper arm, forearm, and hand. In each sites, we have 3 laterality, right, left, and unspecified, and 8 severity, that is skin breakdown, fat exposed, muscle necrosis, bone necrosis, muscle involvement without necrosis, bone involvement without necrosis, other severity, and unspecified severity. So we have totally 116 codes. And in revision, we have revisions in this chapter, that is L02.212 and L02.222. That before the code L02.212 is cutaneous abscess of back, any part except buttocks. Now it's revised to cutaneous abscess of back, any part except buttock and flank, because flank in namakku new codes already updation lo vannitundu. So except flank and revise ചെയ്തിട്ടുണ്ട്. And in code L02 same 222 from furuncle of back, any part except buttocks. Here it's revised to furuncle of back, any part except buttock and flank. And the non-pressure chronic ulcer, these are the new codes L98.431 to L98.439, L98.441 to L98.449, L98.451 to L98.459, L98.461 to L98.469, L98.471 to L98.479, L98.A111 to L98.A119, L98.A121 to L98.A129, and again L98.A191 to L98.A199, L98.A211 to L98.A219, L98.A221 to L98.A229, L98.A291 to L98.A299, L98.A311 to L98.A319, L98.A321 to L98.A329, L98.A391 to L98.A399. These all are new codes under the category of chronic non-pressure ulcer. Moving on to chapter 13, disease of musculoskeletal system and connective tissue M00 to M99. We have guideline changes, multiple sites. Codes describing specific sites are assigned individually by site when documented. When the specified site are not documented, assign the appropriate code for multiple sites. Chapter specific guideline check ചെയ്തിട്ട് വേണം multiple sites in the codes കൊടുക്കാൻ. Specific sites mention ചെയ്തിട്ടുണ്ടെങ്കിൽ individually ഓരോ sites നിങ്ങൾ record ചെയ്യണം. In specific sites document ചെയ്തിട്ടില്ല എങ്കിൽ we can use multiple sites codes. And new codes under the chapter of musculo M05.A, abnormal rheumatoid factor and anti-citrulated protein antibody with rheumatoid arthritis. And we have a code first in that category, rheumatoid arthritis with rheumatoid factor by site M05.00 to M05.8A. ആ കോഡ് ചെക്ക് ചെയ്തിട്ട് കോഡ് ഫസ്റ്റ് ആയിട്ട് കൊടുത്തിട്ട് വേണം M05.A കോഡ് കൊടുക്കാൻ വേണ്ടിയിട്ട്. Then we have M36.3 arthropathy in other blood disorders. Previous 2025 we have M36.3 arthropathy in other blood disorders, but we don't have code first എന്നൊരു condition ഉണ്ടായിരുന്നില്ല. ഇപ്പോൾ code first എന്ന updation വന്നിട്ടുണ്ട്. Underlying conditions such as D75.9 blood disease unspecified, D58.2 other hemoglobinopathies, and D56 related to thalassemia conditions. അത് code first കൊടുത്തിട്ട് വേണം M36.3 എന്ന code കൊടുക്കാൻ. And we have revision in this chapter. that is M21.15 varus deformities, that ball leg condition ആണ് not elsewhere classified unspecified എന്ന code revised to M varus deformity not elsewhere classified unspecified hip എന്ന രീതിയിലേക്ക് ചേഞ്ച് വന്നിട്ടുണ്ട്. And code M24.076 loose body in unspecified toe joints എന്ന code revised to M24.076 loose body in unspecified toe joint or joints, both single and multiple ആയിട്ട് code change വന്നിട്ടുണ്ട്. And M61.129 myositis ossificans progressive unspecified arm and the code change revised to myositis ossificans progressive unspecified upper arm എന്ന രീതിയിൽ revised ആയിട്ടുണ്ട്. Moving on to chapter 14, diseases of genitourinary system, N00 to N99 category. We have N00.5 code acute nephritic syndrome with diffuse mesangiocapillary glomerulonephritis. Previously illa code aanu, but a code in taare we have a mention acute nephrotic syndrome with membranoproliferative glomerulonephritis types 1 and 3 or NOS. That deleted item depo. And we have new codes N00.B acute nephritic syndrome with immune complex membranoproliferative glomerulonephritis, and N00B1 acute nephritic syndrome with idiopathic immune membranoproliferative glomerulonephritis, and N00B2 acute nephrotic syndrome with secondary immune complex membranoproliferative glomerulonephritis. Okay, and N04.5 code nephrotic syndrome with diffuse mesangiocapillary glomerulonephritis. മുൻപ് പറഞ്ഞ സെയിം കണ്ടീഷൻ ഈ കോഡ് പ്രീവിയസ്ലി ഉള്ള കോഡാണ്, ബട്ട് ആ കോഡിന് താഴെ ഉണ്ടായിരുന്ന ഒരു കണ്ടീഷൻ നെഫ്രോട്ടിക് സിൻഡ്രോം വിത്ത് മെംബ്രനോപ്രോലിഫറേറ്റീവ് ഗ്ലോമറുലോനെഫ്രൈറ്റിസ് ടൈപ്പ് 1 and 3 or NOS. That caption deleted ആയിട്ടുണ്ട്. And we have new codes N04.B, B1 and B2. That is B is nephrotic syndrome with immune complex membranoproliferative glomerulonephritis, IC-MPGN. N04.B1 is nephrotic syndrome with idiopathic immune complex membranoproliferative glomerulonephritis, IC-MPGN. And N04.B2 is nephrotic syndrome with secondary immune complex membranoproliferative glomerulonephritis, IC-MPGN. And new code we have N07.B, that is hereditary nephropathy not elsewhere classified with APOL1 mediated kidney disease, AMKD. That code includes AMKD with glomerulonephritis and AMKD with glomerulosclerosis. That's a new code N07.B. And in category N61 code, inflammatory disorders of breast. In that, in exclude one note, before it was inflammatory carcinoma of breast C50.9, it's revised to inflammatory carcinoma of breast C50.A category codes revised ആയിട്ടുണ്ട് because breast inflammatory carcinoma പുതിയ അപ്ഡേഷനിൽ കോഡ്സ് ഒരു 3 കോഡ്സ് ആഡ് ആയിട്ടുണ്ട്. സോ ആ കാറ്റഗറി നോക്കിയിട്ട് നിങ്ങൾ ആഡ് കോഡ്സ് എക്സ്ക്ലൂഡ് 1ൽ നോക്കണം. And next one N85.A code isthmosil, that also previously ഉള്ള കോഡാണ്. ആ കോഡിന്റെ താഴെ കോഡ് ഓൾസോ എന്ന സ്ഥലത്ത് റിവിഷൻ നടന്നിട്ടുണ്ട്. ദാറ്റ് ഈസ് പെൽവിക് ആൻഡ് പെരീനിയൽ പെയിൻ R10.2 എന്ന കോഡ് റിവൈസ് ടു പെൽവിക് ആൻഡ് പെരീനിയൽ പെയിൻ R10.2 കാറ്റഗറി കോഡ്സിലേക്ക് റിവൈസ്ഡ് ചെയ്തിട്ടുണ്ട്. മുന്നേ R10.2 കോഡ് മാത്രമായിരുന്നു. ഇപ്പോൾ അപ്ഡേഷനിൽ R10.2 കാറ്റഗറീസ് കോഡ് വന്നിട്ടുണ്ട്. സോ ചെക്ക് ചെയ്തിട്ട് അത് കോഡ് ഓൾസോയിൽ നോക്കിക്കൊടുക്കുക. This is the end of my session. That is chapter 1 to chapter 14. Thank you.
Thank you, ma'am. Thank you so much for your presentation. Next, the remaining ICD chapter updations will be taken by Dr. Reshmi.
Hi, good evening, everyone. Thank you, ma'am. So, So welcome everyone to the remaining session from chapter 15 onwards, ICD 2026 updates. Hope my voice is audible to everyone. Okay. So there are no new codes in this chapter. Coming to this chapter, pregnancy, childbirth and the puerperium, code ranges from O00 to O9A. In this, O70.1 second degree perineal laceration during delivery have an exclude one note in which the code O perineal laceration involving anal sphincter O70.2 code is revised to perineal laceration involving anal sphincter O70.2 category codes. മുന്നേ നമുക്ക് O70.2 കോഡ് മാത്രമായിരുന്നു. ഇപ്പോൾ നമുക്ക് അതിൻ്റെ സബ് കാറ്റഗറി കോഡ്സും അവൈലബിൾ ആണ്. അപ്പോൾ നമ്മുടെ എന്താണോ ചോദിച്ചിരിക്കുന്നത് അതനുസരിച്ചുള്ള സ്പെസിഫിക് കോഡ് വി ക്യാൻ അപ്ലൈ. Next, coming to chapter 16, certain conditions originating in perinatal period, code ranges from P00 to P96. There are no new codes in this chapter. There is the code revision is there. P09.6 abnormal finding on neonatal screening for neonatal loss is revised to P09.6 abnormal findings on neonatal hearing screening. Next, Q75.009 craniosynostosis unspecified is revised to Q75.009 craniosynostosis unspecified. Q75.021 coronal craniosynostosis unilateral to Q75.021 coronal craniosynostosis unilateral. Q75.022 coronal craniosynostosis bilateral. Q75.029 coronal craniosynostosis unspecified. The new codes under this chapter comes Q87.87 Hua Fountain syndrome, Q87.88 CTNNB1 syndrome, Q89.81 Kabuki syndrome, Q89.89 other specified congenital malformation. More specific codes are available now. And under Usher syndrome, Q99.811 Usher syndrome type 1, Q99.812 Usher syndrome type 2, Q99.813 Usher syndrome type 3, Q99.818 other Usher syndrome, and Q99.819 Usher syndrome unspecified. All these are congenital disorders. Q99.89 other specified chromosomal abnormalities. QA0.0101 SCN2A related neurodevelopmental disorder. QA0.0102 CACNA1A related neurodevelopmental disorder. QA0.0109 neurodevelopmental disorder related to pathogenic variant in other ion channel gene. QA0.011 neurodevelopmental disorder related to pathogenic variant in glutamate receptor gene. QA0.012 neurodevelopmental disorder related to pathogenic variant in other receptor genes. QA0.0131 SLC-GA1 6A1 related disorder, and QA0.0139 neurodevelopmental disorder related to pathogenic variant in other transporter or solute carrier gene. QA0.0141 syntax in binding protein 1 related disorder. QA0.0142 DLGA related synaptophysin. QA0.149 neurodevelopmental disorder related to pathogenic variant in other synapse related gene. QA0.0151 FOXG1 syndrome. QA0.0159 neurodevelopmental disorder related to other genes associated with transcription and gene expression. QA0.8 other neurodevelopmental disorder related to pathogenic variant in other specific genes. Deleted codes are 2 in number. Q89.8 other specified congenital malformations and Q99.8 other specified chromosomal abnormalities. Now coming to chapter 18, symptoms, signs and abnormal clinical and laboratory findings not elsewhere classified. Code ranges from R00 to R99. We have 21 new codes and 2 deleted codes, and there is no revised codes. Coming to the new codes, R10.20 pelvic and perineal pain unspecified side, R10.21 pelvic and perineal pain right side, R10.22 pelvic and perineal pain left side, R10.23 pelvic and perineal pain bilateral, R10.24 suprapubic pain, R10.85 abdominal pain of multiple sides, R10.8A1 right flank tenderness, R10.8A2 left flank tenderness, R10.8A3 suprapubic tenderness, R10.8A9 flank tenderness unspecified, R10.A0 flank pain unspecified side, R10.A1 flank pain right side, R10.A2 flank pain left side, R10.A3 flank pain bilateral. All these codes are related to flank pain. And coming to R11.16 cannabis hyperemesis syndrome. Next one, R39.851 costovertebral angle tenderness right side, R39.852 costovertebral angle tenderness left side, R39.853 costovertebral angle tenderness bilateral, R39.859 costovertebral angle tenderness unspecified side. And coming to R76.81 abnormal rheumatoid factor and anti-citrullinated protein antibody without rheumatoid arthritis, R76.89 other specified abnormal immunological findings in serum. Deleted codes are R10.2 pelvic and perineal pain, R76.8 other specified abnormal immunological findings in serum. No revised codes. And coming to chapter 19, injury, poisoning and certain consequence of external causes, S00 to T88 code range. There are കുറച്ചധികം തന്നെ നമുക്ക് ന്യൂ കോഡ്സ് ഈ ചാപ്റ്ററിൽ വന്നിട്ടുണ്ട്. ന്യൂ കോഡ്സ് 213 കോഡ്സ് ആണ് വന്നിരിക്കുന്നത്. ഡിലീറ്റഡ് 12 കോഡ്സ് ആണ്. റിവൈസ്ഡ് കോഡ്സ് 24 in number. S30 superficial injury of abdomen, lower back, pelvic and external genitalia. Code under this S30.1 contusion of abdominal wall ന്റെ അണ്ടറിൽ നമുക്ക് 3 ന്യൂ കോഡ്സ് വന്നിട്ടുണ്ട്. S30.11, S30.12 and S30.13 contusion of abdominal wall, groin and flank. These codes requires placeholders and 7 characters. And the code S30.8 other superficial injuries of abdomen, lower back, pelvis and external genitalia. We have 3 new codes under this. They are S30.81A, S30.82A, S30.84A, S30.85A, S30.86A, S30.87A, S30.89A, and the anatomical site is flank, related to abrasion, blisters, non-thermal, external constriction, superficial foreign body, insect bite, non-venomous, other superficial bite and unspecified superficial injury to flank. All these codes also require 7 characters. Coming to S31.1 open wound of abdominal wall without penetration into peritoneal cavity, S31.10 unspecified open wound of abdominal wall without penetration into peritoneal cavity. We have 3 new codes under this. They are S31.106, S31.107, S31.10A. The anatomical site mentioned right flank, left flank and unspecified flank. All these codes also require 7 characters. S31.11 laceration without foreign body of abdominal wall without penetration into peritoneal cavity. We have 3 new codes under this. They are S31.116, S31.117, S31.11A. The anatomical site is right flank, left flank and unspecified flank. All these codes also require 7 characters. Coming to S31.12, laceration with foreign body of abdominal wall without penetration into peritoneal cavity. The three new codes coming under this code is S31.126, S31.127, S31.12A, and the anatomical site right flank, left flank and unspecified flank. All these codes also require 7 characters. Coming to S31.13, puncture wound of abdominal wall without foreign body, without penetration into peritoneal cavity. The three new codes under this code is S31.136, S31.137, S31.13A, and the anatomical sites are right flank, left flank and unspecified flank. All these codes require 7 characters. Now coming to the code S31.14, puncture wound of abdominal wall with the foreign body without penetration into peritoneal cavity. The three new codes coming under this codes are S31.146, S31.147, S31.14A, and the anatomical site are right flank, left flank and unspecified flank. All these codes require 7 characters. And coming to the code S31.14, puncture wound of abdominal wall with the foreign body without penetration into peritoneal cavity also consists of 3 new codes. They are S31.146, S31.147, S31.14A, and the anatomical site right flank, left flank and unspecified flank. All these codes require 7 characters. Coming to the code S31.15, open bite of abdominal wall without penetration into peritoneal cavity. 3 new codes under this codes are S31.156, S31.157, S31.15A, and the anatomical sites right flank, left flank and unspecified flank. All these codes also require 7 characters. Coming to the code S31.6, open wound of abdominal wall with the penetration into peritoneal cavity. The code under this S31.60, unspecified open wound of abdominal wall with the penetration into peritoneal cavity consists of 3 new codes. They are S31.606, S31.607, S31.60A, and the anatomical site right flank, left flank and unspecified flank. These codes also require 7 characters. And coming to the code S31.61, laceration without foreign body of abdominal wall with penetration into peritoneal cavity also consists of 3 new codes. They are S31.616, S31.617, S31.61A. Anatomical site right flank, left flank and unspecified flank. All these codes require 7 characters. Coming to the code S31.62, laceration with foreign body of abdominal wall with the penetration into peritoneal cavity. The 3 new codes under this code are S31.626, S31.627, S31.62A. The anatomical site right flank, left flank and unspecified flank. All these codes require 7 characters. And coming to the code S31.63, puncture wound without foreign body of abdominal wall with penetration into peritoneal cavity consists of 3 new codes: S31.636, S31.637, S31.63A. Anatomical sites are right flank, left flank and unspecified flank. These codes also require 7 characters. Coming to the next code S31.64, puncture wound with foreign body of abdominal wall with the penetration into peritoneal cavity. The 3 new codes are S31.646, S31.647, S31.64A. Anatomical site right flank, left flank and unspecified flank. All these codes require 7 characters. Coming to the next code S31.65, open bite of abdominal wall with the penetration into peritoneal cavity consists of 3 new codes. They are S31.656, S31.657, S31.65A, and anatomical sites right flank, left flank and unspecified flank. All these codes require 7 characters. Now coming to the poisoning, T36, poisoning by adverse effect of and underdosing of systemic antibiotics. T36.A, poisoning by adverse effect of and underdosing of fluoroquinolone antibiotic consists of new codes. They are T36.AX, poisoning by adverse effect of and underdosing of fluoroquinolone antibiotics. T36.AX1, T36.AX2, T36.AX3, T36.AX4, poisoning by fluoroquinolone. Is there any problem?
Nothing, ma'am.
Okay. Poisoning by fluoroquinolone, antibiotics, accidental, intentional, self-harm, assault, and underdetermined. All the specific codes are mentioned here. And under T36.AX5, T36.AX6, adverse effect and underdosing fluoroquinolone antibiotics. These codes also require 7 characters. Now coming to the code T65.8, toxic effect of other specified substance. We have new codes. They are T65.8 for toxic effect of xylazine, T65.841, T65.842, T65.843 and T65.844 for toxic effect of xylazine, accidental, intentional, self-harm, assault, underdetermined. These codes also require 7 character. And coming to the next code, T75.8, other specified effects of external causes. We have new code, specific codes. They are T75.83, effects of war theatre, T75.830, Gulf War illness, T75.838, effects of other war theatre. All these codes are new and specified codes. And next code, T78.0, anaphylactic reaction due to food. T78.07, anaphylactic reaction due to milk and dairy products consist of 3 new codes. They are T78.070, T78.071, T78.079, anaphylactic reaction due to milk and dairy products to baked milk with tolerance, reactivity, and anaphylactic reaction due to milk and dairy products unspecified. Next, T78.08, anaphylactic reaction due to X. We have 3 new codes under this. They are T78.080, T78.081, T78.089, anaphylactic reaction due to egg to baked egg with the tolerance, reactivity, and anaphylactic reaction due to X unspecified. All these codes require 7 characters. Next, coming to the code T78.1, other adverse food reaction not elsewhere classified. We have new codes under this. T78.11, other adverse food reaction due to milk and dairy products. T78.110, T78.111, T78.119, other adverse food reaction due to milk and dairy products to baked milk with the tolerance, reactivity, and tolerance or reactivity unspecified. T78.12, other adverse food reaction due to egg also consist of specified code categories. They are T78.120, T78.121, T78.129, other adverse food reaction due to egg to baked egg with tolerance, reactivity, and tolerance or reactivity unspecified. T78.19, other adverse food reaction not elsewhere classified. These codes also require 7 characters. Now the revised codes are S62.9, unspecified fracture of hand. Under this code we have 3 codes. They are S62.90, S62.91 and S62.92. മുന്നേ നമുക്ക് S62.9 ആയിരുന്നു. അതിൻ്റെ അണ്ടറിൽ ഇപ്പോൾ നമുക്ക് സ്പെസിഫിക് കോഡ്സുകൾ വന്നതാണ്. അനാറ്റമിക്കൽ സൈറ്റ് വന്നിട്ട് അൺസ്പെസിഫൈഡ് റൈറ്റ് ആൻഡ് ലെഫ്റ്റ് ഹാൻഡ് ആണ്. ഇനി S74.2, ഇഞ്ചുറി ഓഫ് ക്യൂട്ടേനിയസ് സെൻസറി നെർവ് അറ്റ് ഹിപ്പ് ആൻഡ് തൈ ലെവൽ is revised to S74.21, injury to cutaneous sensory nerve at hip and thigh level, right leg. This code requires a placeholder and 7 character. Now coming to chapter 20, external causes of morbidity. Code ranges from V00 to Y99. We have new codes. They are 11, deleted codes 0, revised code 1. Coming to the new codes, W44 H9XA, other sharp object entering into or through a natural orifice, initial encounter. Next, W44.H9XD, other sharp object entering into or through a natural orifice, subsequent encounter. W44.H9XS, other sharp object entering into or through a natural orifice, sequela. W45.3XXA, fishing hook entering through skin, initial encounter. W45.3XXD, fishing hook entering through skin, subsequent encounter. W45.3XXS, fishing hook entering through skin, sequela. Now coming to Y, 36.A1XA, low level blast overpressure in VAR operation, initial encounter. Y, 36.A1XD, low level blast overpressure in VAR operation, subsequent encounter. Y, 36.A1XS, low level blast overpressure in VAR operation, sequela. Y, 36.A2XA, high level blast overpressure in VAR operation, initial encounter. Y, 36.A2XD, high level blast overpressure in VAR operation, subsequent encounter. Y, 37.A1XA, low level blast overpressure in military operation, initial encounter. Y, 37.A1XD, low level blast overpressure in military operation, subsequent encounter. Y, 37.A1XS, low level blast overpressure in military operation, sequela. Y, 37.A2XA, high level blast overpressure in military operation, initial encounter. Y, 37.A2XD, high level blast overpressure in military operation, subsequent encounter. Y, 37.A2XS, high level blast overpressure in military operations, sequela. Now Y, 93.L1, activity splitting wood. Y, 93.L9, activity other outdoor activity. Now the detailed codes nil, revised codes are Y07.435, stepbrother perpetrator of maltreatment and neglect. Now coming to chapter 21, factors influencing health status and contact with health services, code ranges from Z00 to Z99. There are 27 new codes, deleted codes are 5 in number, revised code is 1. Coming to the new codes, Z15.05, genetic susceptibility to malignant neoplasm of fallopian tube or tubes. Z15.060, genetic susceptibility to colorectal cancer. Z15.068, genetic susceptibility to other malignant neoplasm of the digestive system. Z15.07, genetic susceptibility to malignant neoplasm of urinary tract. Z15.3, genetic susceptibility to kidney disease. Z40.8, encounter for other prophylactic surgery. Z40.81, encounter for prophylactic surgery for removal of ovaries for persons without non-genetic or familial risk factors. Z40.82, encounter for prophylactic surgery for removal of fallopian tube or tubes for persons without non-genetic or familial risk factors. Z40.89, encounter for other prophylactic surgery. Z59.861, financial insecurity, difficulty paying for utilities. Z59.868, other specified financial insecurity. Z59.869, financial insecurity unspecified. Z77.31, contact with and suspected exposure to Gulf War theatre. Z77.39, contact with and suspected exposure to other war theatre. Coming to Z80.44, family history of malignant neoplasm of fallopian tube or tubes. Z89.11, family history of APOL1 mediated kidney disease AMKD. Z84.19, family history of other disorders of kidney and ureter. Z84.A, family history of exposure to diltiazem. Z85.4A, personal history of malignant neoplasm of fallopian tube or tubes. Z86.00A, personal history in situ neoplasm of fallopian tube or tubes. sets 91.0110 allergy to milk products unspecified, set 91.0111 allergy to milk products with tolerance to baked milk, set 91.0112 allergy to milk products with reactivity to baked milk, set 91.0120 allergy to eggs unspecified, Z 91.0121 allergy to eggs with tolerance to baked eggs, Z 91.0122 allergy to eggs with reactivity to baked eggs, Z 91.B personal risk factors of exposure to diethylestylbestrol. And the deleted codes are Z40.8 encounter for other prophylactic surgery, set 59.86 financial insecurity, set 84.1 family history of disorders of kidney and ureter. We have other new codes coming under these codes. Z 91.011 allergy to milk product, Z 91.012 allergy to eggs, and the revised codes are set 83.718 family history of other colon polyp. Now coming to chapter 22, codes for special purposes have no updates. Thank you.
Thank you, ma'am. Thank you for your presentation. So these are the updations of ICD that have come in 2026. If you have any doubts regarding the section, you can ask in the comment section. And for Arown students, you can directly connect with the teachers. Now let's move on to CPT updations. Dr. Geetu will be explaining CPT chapters E and M2 cardiovascular system updations.
A very good afternoon to everyone. Myself, Dr. Geetu Soman, Medical Coding Faculty at Kottayam Branch. So, we have ICD updations. We have CPT updations. Let me share my screen. Hope my screen is visible to everyone.
Yes, ma'am.
So, CPT, new code 288 new codes are added, 46 revisions, 84 deletions are there. So, total CPT codes in 2025 is 11,321, and the total codes in 2026 is 11,525. So, moving to the chapter-wise additions, evaluation and management. In evaluation and management, there are 2 new codes are added, no deletions, 4 codes are revised. Moving to the new codes, 99445, E code 99453 intended code update remote monitoring of physiological parameters, example weight, blood pressure, pulse oximetry, respiratory flow rate, devices supply with daily recordings or programmed alert transmission 2 to 15 days in a 30-day period. E code add service remote monitoring devices supply, daily recording, and the program data transmission. Time period 2 to 15 days in a 30-day period. Next code 99470. Remote physiological monitoring treatment management services, clinical staff physician, or other qualified healthcare professional time in a calendar month, requiring 1 real-time interactive communication with the patient caregiver during the calendar month first 10 minutes. So, this code will include the services, remote physiological treatment management services based on the data transmissions by the clinical staff, physician, or other qualified healthcare professional. This code, there should be minimum 1 real-time interactive communication should be there with the patient or the caregiver. Time period for the services 10 to 19 minutes service time per minute. So, moving to the revised codes 99453, remote monitoring of physiological parameters, example weight, blood pressure, pulse oximetry, respiratory flow rate, initial setup, and patient education on use of equipment. This code description changes same description or additional instructions do not report 99453 for cumulative monitoring of less than 2 days in a 30-day period. So, monitoring minimum 2 days patient monitoring report. Then 99454 remote monitoring of physiological parameters, example weight, blood pressure, pulse oximetry, respiratory flow rate. Initial devices supply with daily recordings or programmed alerts transmission each 30 days. ഈ കോഡിന്റെയും ഡിസ്ക്രിപ്ഷനിൽ ചേഞ്ചസ് ഒന്നുമില്ല. ടൈം പീരീഡിലാണ് മാറ്റം വരുത്തിയിട്ടുള്ളത്. ഈച്ച് 30 days എന്നുള്ളത് 16 to 30 days ആയിട്ട് ചേഞ്ച് ചെയ്തിട്ടുണ്ട്. The next code 99457. RPM treatment management services, clinical staff physician, other qualified healthcare professional time in a calendar month requiring interactive communication with the patient caregiver during the calendar month, first 20 minutes. 99470 എന്ന് പറഞ്ഞിട്ട് പുതിയ കോഡ് ആഡ് ചെയ്തതുകൊണ്ട് 99457 ഇതിന്റെ ഇന്റൻഡഡ് കോഡ് ആയിട്ടാണ് ചേഞ്ച് ചെയ്തിട്ടുള്ളത്. 99470 ടൈം ലിമിറ്റ് പറഞ്ഞത് 10 minutes to 19 minutes ആണ്. So 99457 minimum 20 minutes to maximum 39 minutes വരെ നമുക്ക് 99457 റിപ്പോർട്ട് ചെയ്യാം. Additional വരുന്ന 20 minutes we have an add-on code 99458. Then moving to the anesthesia chapter, there is no updations in anesthesia. Then moving to the surgery chapters. In surgery, 79 new codes are added. 12 codes are revised, 24 codes are deleted. The total number of CPT codes in surgery, 113. Moving to the integumentary system. Integumentary system, there is no additions, no deletion. Only one code is revised, 10040. Extraction, mass utilization, opening or removal of multiple media, comedon cyst, pustules. 2025 ഇത് ആക്നെ സർജറിക്ക് വേണ്ടി നമ്മൾ റിപ്പോർട്ട് ചെയ്തിരുന്ന കോഡായിരുന്നു. അത് ആക്നെ സർജറി എന്നുള്ളത് റിവൈസ് ചെയ്ത് എക്സ്ട്രാക്ഷൻ ആക്കി 2026 മാറ്റിയിട്ടുണ്ട്. Then moving to the musculoskeletal system. 2 new codes are added in musculoskeletal system, 2 deletions and 2 revisions. Additions വന്നിട്ടുള്ളത് 27458 27713 കോഡുകളിലാണ്. 27458 femur osteotomy with externally controlled intramedullary lengthening devices. കോഡിൽ പറഞ്ഞിട്ടുള്ള പ്രൊസീജിയർ ഓസ്റ്റിയോട്ടമി ആണ്. സൈറ്റ് പറയുന്നത് ഫെമർ ആണ്. And the procedure is insertion of an intramedullary lengthening device. Intramedullary lengthening device means it's a surgical process that allows the gradual bone growth to correct the lung dispensary so the congenital deformities. Right side, left side, limbuകൾ തമ്മിൽ ഡിഫറൻസുകൾ ഉണ്ടെന്നുണ്ടെങ്കിൽ അത് കറക്റ്റ് ചെയ്യാൻ വേണ്ടിയിട്ട് ചെയ്യുന്ന ഒരു പ്രൊസീജിയർ ആണിത്. And this procedure is include radiological supervision and interpretations included ആണ്. Unilateral code ആണത്. One side ആണ് surgical procedure ചെയ്യുന്നതെങ്കിൽ we can report 27458. For bilateral procedures, we can report modify 50 with 27458. And the next code is 27713. Tibia, including fibula, osteotomy with externally controlled intramedullary lengthening devices. Here also the site is tibia plus fibula, including fibula. The procedure is osteotomy. Here also there is an insertion of a lengthening device intramedullarly, which can also controlled externally. This is also for unilateral purpose. Unilateral site report ചെയ്യാൻ വേണ്ടിയിട്ടാണ് 27713 നമ്മൾ റിപ്പോർട്ട് ചെയ്യുന്നത്. Bilateral ആണെന്നുണ്ടെങ്കിൽ we can add modify 50. And radiological supervision and interpretations are also included in 27713. Then moving to the deleted codes, 27445 arthroplasty knee hinge prosthesis Valius type is a deleted code, and 27468 is also deleted. Osteoplasty femur combined lengthening and shortening with femoral segment transfer. Moving to the revised codes, 27278 arthrodesis sacroiliac joint percutaneous or minimally invasive with image guidance, including obtaining bone graft when performed. Unilateral placement of intra-articular devices without cortical piercing. The code the procedure is arthrodesis, then the site is sacroiliac joint. Arthrodesis with the placement of an intra-articular devices. Importance without cortical piercing. The bone in the iliac sacroiliac cortex, the external part piercing with the placement of intra-articular devices. Then moving to the next code, 27279, placement of transarticular devices and or intraarticular devices, piercing the lateral or medial cortices of the ilium and the lateral cortex of the sacrum. Here also the procedure arthrodesis തന്നെയാണ് sacroiliac jointലാണ് ചെയ്യുക. And the placement of transarticular devices and or intraarticular devices. രണ്ടും കൂടിയാണ് നമ്മളതിനെ head procedure ആയിട്ടാണ് പറയുക. Here, there is the piercing in the ilium and the sacrum. Piercing of the lateral or medial cortices of ilium and the lateral cortex of the sacrum. So the guidelines do not report 27278 and 27279 for the same joint because 27278 പറയുന്നത് arthrodesis without piercing ആണ്. 27279 പറയുന്നത് arthrodesis sacroiliac joint with piercing ആണ്. Use modifier 50 when the procedure is performed bilaterally. Use modifier 50 when the procedure is performed bilaterally. For HIPE procedures means involving both the intra and transarticular devices are reported with 27279 when the device pierces the cortices. Moving to the respiratory system. In respiratory system also, there is no additions, no deletions, or no revisions. Then cardiovascular system. CPT la ഏറ്റവും കൂടുതൽ changes വന്നിട്ടുള്ള ഒരു portion ആണ് cardiovascular system. So in cardiovascular system, there are 48 CPT codes are added, 20 codes are deleted, and 4 revised codes are there. Endovascular repair of thoracic aorta ആണ് new codes add ചെയ്തിട്ടുള്ളത്. First code പറയുന്നത് 33882 endovascular repair of the thoracic aorta using branched or fenestrated multiphase endograft system involving an aortic tube device with a fenestration for the left subclavian artery. And the procedure is endovascular repair. The site is thoracic aorta. In 2025, it is descending thoracic aorta procedures and but ഇവിടെ thoracic aorta ആണ് പറയുന്നത് using a graft which is a branched or fenestrated multiphase endograft system with fenestration for the left subclavian artery. Fenestration means there is a holes in the graft. So the procedures included in this services are pre-procedure sizing, device selection, target zone angiography, all non-catheter, non-selective catheterization, and selective catheterization for left subclavian artery, and all the radiological supervision and interpretations are included in 33882. Then the next new code 35602 ഇത് ആഡ് ചെയ്തിട്ടുള്ളത് ബൈപ്പാസ് ഗ്രാഫ്റ്റിലെ അതർ ദാൻ വെയിൻസ് എന്ന് പറഞ്ഞ സെക്ഷനിലാണ് 35602 ന്യൂ കോഡ് ആഡ് ചെയ്തിട്ടുള്ളത്. ഓപ്പൺ കെരോട്ടിഡ് ബൈപ്പാസ് ഗ്രാഫ്റ്റ് അതർ ദാൻ വെയിൻ ആണ്. ഇത് ടു റീഡിറക്ട് the blood flow from one carotid artery to the opposite side. Usually ഈ 36602 കോഡ് നമ്മൾ റിപ്പോർട്ട് ചെയ്യുന്നത് endovascular repair of thoracic aorta ഒരു mandatory or necessary prior step ആയിട്ടാണ് 35602 നമ്മൾ റിപ്പോർട്ട് ചെയ്യുന്നത്. Then the revised codes 33880 thoracic endograft including all distal extension grafts including the coverage of the left subclavian artery. In 2025 thoracic artery descending descending thoracic aorta ennu parnathu 33880 thoracic endograft aanu, and this includes all distal extension grafts. Then next code 33881 thoracic endograft including all distal extension grafts not covering the left subclavian artery. 33883 delayed placement of proximal extension prosthesis. In 2025, there is placement of proximal extension prosthesis there, and the revised the delayed placement of proximal extension prosthesis ആക്കി change ചെയ്തിട്ടുണ്ട്. 33886 delayed placement of distal extension prosthesis. Then revision 33880 and 33881 includes all proximal and distal extension and anatomical code differentiations. 33883 replaces the deleted code 33884, 33889, and 33891. Report once per session regardless of number of modules. thoracic aortic endograph codes deleted കോഡുകളാണ്. 33884 is deleted, and in place of 33884 we can use 33883. 33889 is also deleted. For open subclavian to carotid transpositions, we can use 35694 instead of 33889. 33891 for it's also deleted. For carotid to carotid bypass, instead of 33891, we can report a new code 35602. In 2026, all the radiological supervisions and interpretations are included in the thoracic aortic endograph codes. So 75956, 75957, 75958, 75959 are deleted. These codes are bundled in 2026 updates. Then moving to the lower extremity revascularization procedures. New codes. Lower extremity revascularization coding purpose nu vendite 2025 3 vascular territories ആയിട്ടായിരുന്നു ഡിവൈഡ് ചെയ്തിരുന്നത്. In 2026 4 vascular territories ആയിട്ട് അത് അപ്ഡേറ്റ് ചെയ്തിട്ടുണ്ട്. Iliac, femoral and popliteal, tibial and peroneal, and inframalleolar territory. Inframalleolar territory 2026 new ആയിട്ട് ആഡ് ചെയ്തിട്ടുള്ള ഒരു ടെറിട്ടറി ആണ്. And iliac territory common iliac arteries, internal iliac arteries, and external iliac arteries are included. Femoral and popliteal territory, common femoral, profunda femoris, superficial femoral, and popliteal arteries are included. Tibial and peroneal territory, anterior tibial, posterior tibial, and peroneal arteries are included. In inframalleolar territory, dorsalis pedis and plantar arteries are included. Then ഓരോ ടെറിട്ടറിയും നമ്മൾ കോഡ് ചെയ്യുന്നത് these codes are applicable to both open and percutaneous approaches. Lower extremity ചെയ്യുന്ന revascularization procedures, open procedures ആണെങ്കിലും percutaneous approachലാണെങ്കിലും ഈ സെക്ഷനിലുള്ള കോഡുകൾ നമുക്ക് റിപ്പോർട്ട് ചെയ്യാം. 4 territories, as I already said, iliac, femoral, popliteal, tibial, and inframalleolar territories are added. Then കോഡ് ചെയ്യുമ്പോൾ ഇവിടെ ഒരു എക്സ്ട്രാ പോയിന്റും കൂടി ആഡ് ചെയ്തിട്ടുണ്ട്. ഡിസോർഡേഴ്സ് അല്ലെങ്കിൽ ഡിസീസിനെ സ്റ്റെനോസിസ് എന്നും അല്ലെങ്കിൽ സ്ട്രേറ്റ് ഫോർവേഡ് ലീഷൻസ് എന്നും കോംപ്ലക്സ് ലീഷൻസ് എന്നും 2 രീതിയിൽ ഡിവൈഡ് ചെയ്തിട്ടുണ്ട് കോഡുകളിൽ. സ്ട്രേറ്റ് ഫോർവേഡ് ലീഷൻസ് എന്ന് പറഞ്ഞാൽ സ്റ്റെനോസിസ് ആണ്. മീൻസ് ഈ ലോവർ എക്സ്ട്രിമിറ്റി ആർട്ടറീസിൽ അറൌണ്ട് 50 to 99.9% ഒക്ലൂഷൻസ് ആണെങ്കിൽ നമുക്കതിനെ സ്ട്രേറ്റ് ഫോർവേഡ് ലീഷൻസ് ആയിട്ട് കൺസിഡർ ചെയ്യാം. 100% ഒക്ലൂഷൻ, കംപ്ലീറ്റ്ലി ഒക്ലൂഡഡ് ആയിട്ടുള്ള ലോവർ എക്സ്ട്രിമിറ്റിയിലെ ആർട്ടറീസിലാണ് റീവാസ്കുലറൈസേഷൻ ചെയ്യുന്നതെങ്കിൽ നമ്മൾ അതിനെ കോംപ്ലക്സ് ലീഷൻസ് ആയിട്ടാണ് കൺസിഡർ ചെയ്യുന്നത്. And the procedures involved are angioplasty, stent placement, arthrectomy, and stent with arthrectomy. Angioplasty is a common procedure. Then moving to in iliac vascular territory, the vessels included are common iliac, internal iliac, and external iliac arteries. And the procedures involved in iliac territory are angioplasty and angioplasty with the stent placement. Codes are again divided based on the procedures and also based on the lesions. 27254 is reported for the initial vessel. Iliac vascular territory first vessel or initial vessels സ്ട്രേറ്റ് ഫോർവേഡ് ലീഷൻസിൽ ചെയ്യുന്ന ആൻജിയോപ്ലാസ്റ്റി കോഡുകൾക്കാണ് 37254 നമ്മൾ റിപ്പോർട്ട് ചെയ്യുന്നത്. സെയിം 37256 റിപ്പോർട്ട് ചെയ്യുന്നത് സെയിം ടെറിട്ടറി ഇലിയാക് വാസ്കുലാർ ടെറിട്ടറിയിലുള്ള ഇനിഷ്യൽ വെസൽസിൽ ചെയ്യുന്ന കോംപ്ലക്സ് ലീഷൻസിൽ ആൻജിയോപ്ലാസ്റ്റി ചെയ്യുന്നതിന്റെ കോഡാണ് 37256. 37258 and 37260 are procedures angioplasty along with stent placement. 37258 report ചെയ്യുന്നത് both procedures single vessel initial vessels straight forward lesions ചെയ്യുന്ന revascularization procedures ലാണ്. Then complex lesions ആണെന്നുണ്ടെങ്കിൽ 37260 നമ്മൾ റിപ്പോർട്ട് ചെയ്യുന്നു. ഇത് ഇനിഷ്യൽ വെസൽസിന്റെ കോഡുകളാണ്. അഡീഷണൽ കോഡുകൾക്ക് അല്ല അഡീഷണൽ വെസൽസിൽ ചെയ്യുന്ന കോഡുകൾക്ക് ആഡ് ഓൺ കോഡുകളുണ്ട്. 37255, 37257 ആൻജിയോപ്ലാസ്റ്റി ഓൺലിയിലാണ് ചെയ്യുക. 37259 and 3726 ആൻജിയോപ്ലാസ്റ്റി വിത്ത് സ്റ്റെന്റ് പ്ലേസ്മെന്റ്. 2026 അപ്ഡേറ്റ്സിൽ ഒരു അഡീഷണൽ ആഡ് ഓൺ കോഡ് കൂടി ആഡ് ചെയ്തിട്ടുണ്ട്. ലിത്തോട്രിപ്സിയുടെ കോഡാണ് 37262 ആണത് പറയുക. ഹാർഡ് ആയിട്ടുള്ള കാൽസിഫൈഡ് പ്ലേക്കുകളെ ബ്രേക്ക് ചെയ്യാൻ വേണ്ടിയിട്ട് ചെയ്യുന്ന ഒരു പ്രൊസീജിയർ ആണ് ലിത്തോട്രിപ്സി പ്രൊസീജിയർ. ഇത് ഇലിയാക് വാസ്കുലാർ ടെറിട്ടറിയിലും ഫെമറൽ അല്ലെങ്കിൽ പ്രൊപ്ലീറ്റിയൽ ടെറിട്ടറിയിലുമാണ് ഈ രണ്ട് ലിത്തോട്രിപ്സി കോഡുകൾ ആഡ് ചെയ്ത് വന്നിട്ടുള്ളത്. സോ ലിത്തോട്രിപ്സി 37260 അപ് ടു 3 വെസൽസിലാണ് ചെയ്യുക. ബിക്കോസ് ഇലിയാക് വാസ്കുലാർ ടെറിട്ടറിയിൽ 3 വെസൽസ് ആണ് പറയുക. സോ അപ് ടു 3 per legs. Use code for most complex services when multiple lesions are treated. No add-on code for additional lesions in the same vessel. Iliac arthrectomy, we have to code 0238T. Next vascular territory is femoral or popliteal territory. The vessels included are common femoral, profunda femoris, superficial femoris, popliteal vessels. For the coding purpose, common femoral, profundus femoris ne kudu single vessel aayittu consider cheyunu. Superficial femoral name, popliteal vessel name കൂടി ഒരു single vessel ആയിട്ടാണ് consider ചെയ്യുക. In femoral and popliteal territory, the procedures involved are angioplasty, angioplasty with stent placement, angioplasty with arthrectomy, angioplasty, stent placement and arthrectomy. 4 procedures are there. 27263, 27265 പറയുന്നത് femoral popliteal territory angioplasty straightforward lesions ചെയ്യുന്നതിന്റെ കോഡുകളാണ്. Then straightforward and complex lesions ഉള്ളത് 37267, 37269 കോഡുകൾ femoral popliteal territory ചെയ്യുന്ന angioplasty with stent placement. Straightforward lesions ആണെന്നുണ്ടെങ്കിൽ 37267, complex lesionൽ 37269 ആണ് റിപ്പോർട്ട് ചെയ്യുക. 37271, 37273 angioplasty with arthrectomy കോഡുകളാണ്. Straightforward lesions 37271. Then complex lesions 37273 report ചെയ്യാം. 37275 and 37277 are reported for angioplasty along with stent placement and arthrectomy. For straightforward lesions, we can report 37275, and for the complex lesions, we can report 37277. The single vessels ചെയ്യുന്ന procedures ആണ്. Additional vessels ഉണ്ടെന്നുണ്ടെങ്കിൽ we can use the add-on codes 37264, 37266, 37268, 37270, 37272, 37274, 37276, and 37278. Along with and the procedures, if lithotripsy കൂടി ചെയ്യുന്നുണ്ടെന്നുണ്ടെങ്കിൽ we can use an add-on code 37279 up to 2 vessels. Because I already said common femoral profunda femoris single vessel ആയിട്ട് കൺസിഡർ ചെയ്യുന്നു. Superficial femoral popliteal single vessel ആയിട്ടാണ്. So lithotripsy 37278 up to 2 vessels per leg. Use most complex codes when multiple lesions are treated. No add-on code for additional lesions in the same vessel. Next, moving to the tibial and peroneal territory, and this include anterior tibial vessels, posterior tibial and peroneal vessels. Here also, the 4 procedures are included. For angioplasty, 37280, 37282 codes can be reported. And for angioplasty and stent placement, we can report 37284 and 37286. For angioplasty and atherectomy, we can report 37288 and 37290. For angioplasty, stent placement and atherectomy, we can report 37292 and 37294. For additional vessels, we can report the add-on codes 37281, 37283, 37285, 37287, 37289, 37291, 37293, 37295. ഇവിടെ ഈ ടിബിയൽ ആൻഡ് പെരിറ്റോണിയൽ ടെറിട്ടറിയിൽ ലിത്തോട്രിപ്സിയുടെ കോഡുകൾ ആഡ് ചെയ്തിട്ടില്ല. ടിബിയോ പെരോണിയൽ ട്രങ്ക്. Here also tibial peroneal trunk name is a part of posterior tibial and peroneal vessel ആയിട്ട് തന്നെയാണ് കൺസിഡർ ചെയ്യുന്നത് for the coding purpose. Tibial peroneal trunk not separate unless it is the only vessel treated. Use most complex codes when the multiple lesions treated. No add-on for additional lesions in the same vessels. Then moving to the last territory, inframalleolar territory, and it includes dorsalis pedis and plantar. Here, angioplasty മാത്രമാണ് പറഞ്ഞിട്ടുള്ളത്. For the straightforward lesions, we can report 37296, and for the complex lesions, we can report 37298. Then, for additional vessels, we can use the add-on code 37297 and 37299. Here also, pedal arch, അതിനെ ഒരു separate vessel ആയിട്ട് consider ചെയ്യുന്നില്ല. It's also considered as a part of dorsalis pedis and plantar. Plantar arch is not separate unless it is the only vessel treated. Use most complex code when the multiple lesions treated. No add-on code for the additional lesions in the same vessels. So, lower extremity arterial vascularization overview. Codes are applicable to both open and percutaneous approach. Four territories are there: iliac, femoral popliteal, tibial, and inframalleolar. Stenosis means the straightforward lesions and the complex lesion. For initial vessels and additional vessels, we have separate codes. The procedure angioplasty for all four territories. Stent placement for all except inframalleolar territory. Atherectomy is also for all except iliac and inframalleolar territory. Stent with atherectomy is also not for iliac territory and not for inframalleolar territory. Intravascular lithotripsy for iliac and intravascular lithotripsy for femoral popliteal vessels, not for tibial or inframalleolar territory. Then the deleted codes in 2025, 37220 to 37224. There are 4 codes are there, 4 codes are deleted. Instead of these 4 codes, 9 new codes are added. 37254 to 37262 in iliac territory. And in femoral and popliteal territory, 4 codes are deleted, 37224 to 37227, and 17 new codes are added, including the lithotripsy code. And in tibial and peroneal territory, 4 codes are deleted and 16 codes are added, 37280 to 37295. In inframalleolar territory, 4 codes are deleted and 4 new codes are added. 1 code has been deleted from the vascular endoscopy 37500, vascular endoscopy surgical with ligation of the perforated vein subfascial. So that's all about my session. Thank you.
Thanks for the presentation, ma'am. The next CPT chapters, digestive system to radiology updations, will be explained by Dr. Zakia. Now the floor is yours, ma'am.
Thank you, Kirtana ma'am, for the invite. Myself, Dr. Zakia. I'm a DHMS graduate, currently working as a medical coding faculty in Arown Academy. Okay, so in this session, we are going to discuss about the CPT updations of chapters, digestive system, genitourinary system, nervous system, and radiology. So first moving on to the digestive system. In digestive system, we have 2 additions. In digestive system, we have 2 additions, no deletions, no revisions. So let us look the new codes. One is 43889, describing endoscopic sleeve gastroplasty. It's an endoscopic procedure for gastric restrictive procedure. Next new code is 47384. It's a percutaneous ablation of liver tumors using irreversible electroporation. Both these procedures are minimally invasive. So these codes represent our surgery is growing from open complex procedure to minimally invasive procedure. So we can reduce the procedure morbidity and post-procedural discomfort. So moving on to the next system, genitourinary system. Then in genitourinary system, we have new 14 codes, then 2 deleted codes, 2 revisions. As you all know, genitourinary system is, there are 3 sections: urinary system, male genitalia, and female genitalia. So first, urinary system, there is 2 new codes. First new code is 52443, cystourethropy with a initial transurethral anterior prostate commissurotomy with a non-drug coated balloon catheter, followed by therapeutic drug delivery into the prostate by a drug coated balloon catheter, including transrectal ultrasound and fluoroscopy when performed. So it's also a new technique combining mechanical dilation with a localized drug delivery. Another new code is 52597, transurethral robotic assisted water jet dissection of the prostate. It's also a new technique, and the code describes the distinct technology and planning involved, including intraoperative planning, ultrasound guidance, control of post-operative bleeding, complete, including vasectomy, neotomy, cystourethropy, urethral calibration or dilation, and internal urethrotomy when performed. So these two are the new codes, and one deleted code is 52647. Laser coagulation of prostate is deleted, so we don't have to code from 2026 onwards. Then moving on to the male genital system, we have 12 new codes, 1 deleted code and 2 revised code. The revision is major in prostate section, in prostate biopsy and laparoscopic prostatectomy. So first move on to the deleted code in prostate biopsy section, 55700. Biopsy, prostate, needle or punch, single or multiple, any approach. This code is deleted, and a new structure of 9 image-guided biopsy codes has been added to capture the approach and the guidance method. So in this place, the 55700 code is deleted. Instead of that, we have 9 new codes describing the approach and the different imaging guidance. So new codes are 55707, biopsy, prostate, transrectal, ultrasound guided. If the approach is transperineal, we can use 55709. Okay. Then biopsy, prostate, transrectal, ultrasound with MRI fusion guidance, first targeted lesion, can use 55708. If the approach is transperineal, we can use 55710. Okay, then 55711, biopsy, prostate, transrectal, MRI, ultrasound, fusion guided targeted lesions only, first targeted lesion. If the approach is transperineal, we can use 55712. 55713 is the biopsy of prostate in bore, CT or MRI guided with the biopsy of additional targeted lesions, first targeted lesion. Then 55714, biopsy, prostate in bore, CT or MRI guided targeted lesions only, first targeted lesion. Then there is a new add-on code for additional biopsy, each additional MRI, ultrasound fusion or in bore, CT or MRI guided targeted lesions. So in this area, the term sextant means using ultrasound guided biopsy is a systematic biopsy. For systematic use, the prostate is divided into 6 areas, 3 right and 3 left areas. Okay, right apex, right base, right mid, left apex, left base, and left mid. So these areas are called sextant. That's just a systematic biopsy. If there is a discrete lesion found in this systematic biopsy, we are doing target lesion biopsy. Okay, so 55707 and 55709 are just ultrasound guided biopsy in sextant. If any discrete lesions are found, then we use targeted lesion biopsy codes 55708, 710, 711, 712, 713, and 714. Okay, according to image guidance used. Then 55715 is the add-on code in these conditions. So we have a new structure of codes enable us to precise reporting of the approach, imaging technique, and targeted lesions. Okay. And one code 55705 in prostate biopsy section is revised. We have discussed about the new codes. All are image guided. If the prostate biopsy is non-imaging guided, we can use 55705. Okay, we have non-imaging guided code, and for imaging guidance, we have codes for transperineal approach and transrectal approach. Next changes is in prostatectomy 55868 and 55869. Laparoscopic surgical prostatectomy changes new codes 55868 means laparoscopy surgical prostatectomy retropubic radical including nerve sparing, includes robotic assistance when performed with lymph node biopsies, limited pelvic lymphadenectomy. In 55869, that's bilateral pelvic lymphadenectomy, including external iliac, hypogastric, and obturator nodes. So there's a revised code in laparoscopy surgical prostatectomy 55866. The code description is not changed. There are added instructions. These are the changes in genital urinary system. There is no updations in female genital system. So moving on to the next chapter, 6000 series nervous system, eye and auditory system. In this section, we have changes in nervous system. There are 11 additions, no deletions, and 3 revisions. New codes are in percutaneous decompression neural elements. This section we have two new codes 62330 and 62331. Actually, this heading percutaneous decompression of neural elements is new in 2026. So, actually, these codes are in category 3 section in 2025, and now it is transition to category 1 codes as 62330 and 62331 to reflect widespread clinical adoption of minimally invasive lumbar decompression. The code description is 62330 percutaneous decompression with a partial removal of ligamentum flavum, including laminotomy for access, epidurography and imaging guidance, CT or fluoroscopy bilateral, 1 interspace lumbar. There is a new add-on code for each additional lumbar interspace 62331. The code is bilateral. So if we are doing unilateral procedures, we have to report modifier 52 with a 62330. And do not report 62331 more than once per operative session. Okay, next new code is an add-on code, that is 63032. This add-on code is introduced to describe repair of lumbar spinal disc annular defect using a bone anchored closure device. This addition complements existing lumbar decompression codes. So 63032 can be used with the 63030 lumbar decompression codes. This code is repair of annular defect by implantation of bone anchored closure device, including imaging guidance, 1 interspace lumbar. So next new code is for cranial nerve field stimulation technique. The code is 64567 percutaneous electrical nerve field stimulation, cranial nerves without implantation. So next is a new CPT section is added in 2026. Autonomic nerve system modulation, reflecting the increasing use of baroreflex based therapies for resistant hypertension and heart failure. The baroreflex activation therapy modulation system is reported under code 64654 to 64659. It's an FDA approved implantable system. So looking at the codes, 64654 is initial open implantation complete device. There are 2 revision or replacement code 64655 and 64656. 64655 back lead only. Then if the revision is for back pulse generator only, we can use 64656. After that, we have 3 removal codes. If we remove total back system 9, we can use 64657. Removal of back lead only can report 64658. If the removal of back pulse generator only, we can use 64659. Another new code is in neuroplasty section. Now decompression. 64728 percutaneous decompression of median nerve at carpal tunnel with the balloon dilation including ultrasound guidance. It's also a new technique. It's minimally invasive. Minimally invasive carpal tunnel release techniques are so. Though it is minimally invasive, we can reduce the post-operative discomfort and recovery time. Then we have 3 revised codes in nervous system. First, 61624 and 61626, both are in transcatheter vascular occlusion or embolization procedures. In previous year 2025, there is no imaging guidance included. Now, the codes are included, imaging guidance. So, no need to report 7 series codes with the 61624 and 61626. Next revised code is 62287 decompression procedures. The code description is same, but there are added instructional notes. Moving on to the next session, radiology. In radiology, we have 8 new codes, 9 deleted codes, and 3 revised codes. So addition is focusing on new technologies introducing in radiology session. The 3 new codes are in under CT or CTA service in head and neck. So to improve distinction between computed tomographic angiography and cerebral perfusion analysis, whether it is performed with or without concurrent CT. So code is 70471 CTA head and neck with the contrast material, including non-contrast images. The add-on code 70472 computer tomography cerebral perfusion analysis with the contrast material with the concurrent CT or CT angiography. 70473 CT cerebral perfusion analysis with the contrast material, including image post-processing performed without concurrent CT or CT angiography. So, 70471 is CTA code, 70472 and 473 is cerebral perfusion analysis code. If cerebral perfusion is done with the concurrent CT, we can use 70472 add-on code with the CT or CTA code. If cerebral perfusion is doing without concurrent CT, we can use 70473. Cerebral perfusion analysis is a new technique. It's an advanced CT technique evaluate how effectively blood circulates through brain. Then the next new code is 75577 quantification and characterization of coronary atherosclerotic plaque to assess severity of coronary disease. Okay, the next new codes are in the section of surface radiation therapy 774362 77439. 77436 is the surface radiation therapy, superficial orthovoltage treatment planning and simulation aided field setting. If the treatment delivery is less than 150 kV per fraction, we can use 77437 and 77438 orthovoltage delivery greater than 150 to 500 kV per fraction. The add-on code is 77439. Superficial or orthovoltage image guidance, ultrasound for placement of radiation therapy fields for treatment of cutaneous tumors per course of treatment. So there is 3 revised codes in radiation treatment delivery section. In previous year, the description is like simple, intermediate, and complex. Now it is changed to level 1, level 2, and level 3. So 77402 for level 1, 77407 for level 2, 7740412 to level 3. The criteria for level 1 is single electron field, multiple electron field, and 2D photons. The criteria for level 2 is single isocenter, 3D or IMRT, photons. The criteria for level 3 is multiple isocenters with with photon therapy, example 2D, 3D, or IMRT, or a single isocenter photon therapy with active motion management or total skin electrons or mixed electron photon fields. These are the revised codes in radiology. Then deleted codes in radiology is 75842, 75956, 75957, 75958, 75959, 77014, 77401, 77385, 77386. There are major changes in digestive system, genitourinary system, nervous system, and radiology. Hope you all clear. Thank you for listening.
Thank you, ma'am. The remaining CPT chapter updations will be taken by Dr. Adila. Over to you, ma'am.
Okay, thank you, Kirtana ma'am, for your warm welcome. Good afternoon, all. Myself, Dr. Adila Shri from Arown branch. Let's move to the remaining CPT 2026 updation. The chapters include pathology and laboratory, medicine, and category 2 and 3 section. Let me share the presentation. Okay, we can start with the pathology and laboratory section. In pathology and laboratory section, there is 7 additions and there is no deletions, and revisions is 2. Okay, first move to new codes. The new codes came under the Tier 1 molecular pathology procedures and MAAA section and microbiology section, and revisions mainly happen in the chemistry section. Okay, firstly move to the new codes. The first new code came under the Tier 1 molecular pathology procedure. The code describes as 81354, cytogenomic analysis of 4 constitutional chromosomal abnormalities, integration of structural and copy number variant optical genome mapping. Optical genome mapping mainly some rare genetic conditions, some cancers, acute myeloid leukemia, chronic lymphoid leukemia conditions identify test. Next addition came under the multi-unlaid assay with algorithm analysis. That is called the 81524. Oncology, central nervous system tumor. DNA methylation analysis of at least 10,000 methylation sites utilizing DNA extracted from formalin fixed tumor tissue. Algorithm reported as probability of matching a reference tumor family and class, and MGMT. Promoter methylation status if performed. Main item central nervous system tumors identify and test 81524. Okay. Next move to the microbiology section. There is in microbiology section there is 5 new codes are came. First one is 87182. Susceptibility studies, antimicrobial agent, carbapenemase enzyme detection. That is in example Klebsiella pneumoniae carbapenemase, New Delhi metallo-beta-lactamase, Verona intragone encoded metallo-beta-lactamase. That is multiplex immunoassay, qualitative per isolate. There is another new code is 87183. Susceptibility studies, antimicrobial agent, carbapenem resistant genes. That's an example BLA-KPC, BLA-NDM, BLA-OXA48, BLA-ALMP. Amplified probe technique per isolate. There is another new code came under that microbiology section, that is 87494. Infectious agent detection by nucleic acid, maybe RNA or DNA. Chlamydia trachomatis and Neisseria gonorrhea multiplex amplified probe technique. Already we have 2 codes undairunnu. Chlamydia trachomatis 87491, Neisseria gonorrhea 87591. Separate codes aayirunnu. Now came under a combination code for these 2 conditions 87495. Next changes happened in 87627. There is a new code. Infectious agent detection by nucleic acid, DNA or RNA, joint space pathogens and drug resistant genes. Multiplex, amplified, probe technique, 26 or more targets. And there is another new code is 87812, infectious agent antigen detection by immunoassay with direct optical observation, COVID-19 and influenza virus type A and B. Here also a one code for COVID-19, that is 87804, and one code for influenza virus type A and B, that is 87811. Now a combination code for COVID-19 and influenza, that is 8781. These are newly added codes in pathology section. Next, we move to the revision under the pathology and laboratory section. That came under the chemistry section. In chemistry section, there's main revision happened in updated heavy metal testing codes. There is 2 heavy metal analysis codes are revised for clarity and accuracy. That's the first new code is revised 83015. The code describes as heavy metal, example arsenic, barium, beryllium, bismuth, antimony, gadolinium, mercury, qualitative, any number of analytes. Before that, നമുക്ക് ഗഡോലിനിയം എന്നുള്ളൊരു മെറ്റൽ ഉണ്ടായിരുന്നില്ല. അതുപോലെ തന്നെ ഈ എക്സാംസിന്റെ ഓർഡർ ജസ്റ്റ് ഒന്ന് റിവൈസ് ചെയ്തിട്ട്. ഓക്കെ, നെക്സ്റ്റ് സെയിം കോഡ് അണ്ടർ ക്വാണ്ടിറ്റേറ്റീവ് 83018 ഹെവി മെറ്റൽ, arsenic, barium, beryllium, bismuth, antimony, gadolinium, mercury. Quantitative, each not elsewhere classified. Quantitative ആയിട്ട് 83018. Here also a gadolinium, a new metal, is also added. That's a revision happening pathology section. Next, move to the last section of laboratory and pathology section, proprietary laboratory analysis, PLA section. എപ്പോഴും നമുക്ക് എക്സാം പോയിന്റ് ഓഫ് വ്യൂവിൽ നമുക്ക് ഒരിക്കലും ഇമ്പോർട്ടൻസ് കൊടുക്കാത്ത ഒരു സെക്ഷനാണ് PLA സെക്ഷൻ എന്ന് പറയുന്നത്. PLA സെക്ഷനിൽ നമുക്ക് മെയിൻ ആയിട്ട് 79 കോഡ്സ് ആഡ് ചെയ്തിട്ടുണ്ട്, 13 കോഡ്സ് ഡിലീറ്റഡ് ആയിട്ടുണ്ട്, then 3 കോഡ്സ് ആർ റിവൈസ്ഡ്. The PLA code range, PLA code describe ചെയ്യുന്നത് നമുക്ക് കാറ്റഗറി 1 കോഡുകൾ പോലെയല്ല, എങ്ങനെയാ ആൽഫ ന്യൂമറിക് കോഡ്സ്, അതായത് 4 digits followed by alphabet Q. PLA code range 0001U to 0599U. PLA codes created in response to Protective Access to Medicare Act of 2014 are listed along with their proprietary names. These codes are also located at the end of pathology and laboratory section of CPT code set. Okay, then these analyses may include range of medical laboratory tests, including but not limited to multi-analyte assay with algorithm analysis and genomic sequencing procedures. The descriptor nomenclatures follows where possible existing code convention. That is example MAAA and GSP. And PLA codes does not fulfill the category 1 code criteria. PLA codes mainly used for the accurate billing. These are the new codes came under the PLA section. There is a 79 new codes, like category 0521U to 0599U. And there is 3 codes are revised, that are 0095U, 0285U and 0365U. And 13 codes are deleted, that are 0240U, 0241U, 0346U, 0369U, 0370U, 0373U, 0374U, 0380U, 0428U, and 0448U, 0450U, 0451U, and 0456U. These codes are deleted. And in the text, in some sections, has been revised in PLA. Okay, this is all about the pathology and laboratory section. Next, move to the medicine section. Major changes വന്നിരിക്കുന്ന ഒരു സെക്ഷനാണ് മെഡിസിൻ സെക്ഷൻ എന്ന് പറയുന്നത്. മെയിൻ ആയിട്ട് നമുക്ക് E&M സെക്ഷൻ, ഇവാലുവേഷൻ ആൻഡ് മാനേജ്മെന്റ് സെക്ഷൻ, അതുപോലെ തന്നെ നെർവസ് സിസ്റ്റം, കാർഡിയോളജി, എല്ലാ സെക്ഷനിലും വന്ന അതേപോലെയുള്ള ചേഞ്ചസ് മെഡിസിൻ സെക്ഷനിലും വന്നിട്ടുണ്ട്. Okay, next move to the medicine section. In medicine section, there is a 37 additional codes came, and 17 codes are deleted and 18 codes are revised. Firstly, we move to the first section of medicine. That's immunization section. first new code came under the immunoglobulin section, that is 9038U. 9038U describe respiratory syncytial virus, monoclonal antibody, seasonal dose, 0.7 ml for intramuscular use. Already നമുക്ക് 0.5 ml ഡോസേജിനും അതുപോലെ തന്നെ 1 ml ഡോസേജിനുള്ള കോഡുകൾ ഉണ്ടായിരുന്നു. ഇപ്പൊ അഡീഷണൽ ആയിട്ട് 0.7 ml ഡോസേജിനുള്ള കോഡാണ് 90382 എന്ന് പറയുന്നത്. നെക്സ്റ്റ് അപ്ഡേഷൻ വന്നൊരു സെക്ഷനാണ് വാക്സിൻ ആൻഡ് ടോക്സോയിഡ് അഡ്മിനിസ്ട്രേഷൻ സെക്ഷൻ. There is a new code that is 90481. 90481 described as COVID-19 vaccine, each additional component administration. നേരത്തെ 2025 നമുക്കുണ്ടായിരുന്ന കോഡ് 90480 എന്നുള്ള കോഡ് COVID-19 അഡ്മിനിസ്ട്രേഷൻ സിംഗിൾ ഡോസിനുള്ള കോഡായിരുന്നു. ഇപ്പോൾ ആ കോഡ് തന്നെ 2 കോഡ്സ് ആയിട്ട് റീപ്ലേസ് ചെയ്തിട്ടുണ്ട്. അതായത് 90480 എന്നുള്ള കോഡ് റിവൈസ് ചെയ്തു, ഫസ്റ്റ് ഓർ ഓൺലി component of COVID vaccine, and there is a new code came under this section, that is 90481, each additional component administration. And again in vaccine administration section there is another new code. Another new codes came under this section, 90482, 483 and 90484. These codes describe in 90460 and 461. That code describe the vaccine administration and counseling done on same day. വാക്സിൻ അഡ്മിനിസ്ട്രേഷനും അതുപോലെ കൗൺസിലിങ്ങും സെയിം ഡേ കൊടുക്കുമായിരുന്നെങ്കിൽ നമുക്ക് 90460, 461 എന്നുള്ള കോഡുകൾ ഉണ്ടായിരുന്നു. ഇപ്പൊ നെക്സ്റ്റ് അപ്ഡേഷൻ ആയിട്ട് ഈ ഇയറിൽ വന്ന അപ്ഡേഷൻ എന്ന് പറയുന്നത് കൗൺസിലിംഗ് ഡിഫറെന്റ് ഡേയിലാണ് കൊടുക്കുന്നത്. അതായത് വാക്സിൻ അഡ്മിനിസ്ട്രേഷൻ ഒരു ഡേയിലും കൗൺസിലിംഗ് സെപ്പറേറ്റ് ഡേയിലും ആണെങ്കിൽ കൗൺസിലിംഗ് എത്ര ടൈം കൗൺസിലിംഗ് കൊടുത്തിട്ടുണ്ട് അതിന്റെ ബേസിലുള്ള കോഡ്സ് ആണ് വരുന്നത്. 90482 immunization counseling 3 minutes to 10 minutes. Then next code 90483 immunization counseling greater than 10 minutes to up to 20 minutes. Then next code 90484 immunization counseling greater than 20 minutes. Separate daily vaccine counseling കൊടുക്കുകയാണെങ്കിൽ ഈ ന്യൂ കോഡ്സ് ആണ് യൂസ് ചെയ്യേണ്ടത്. Next change came under the vaccine or toxoid section, that is product section. First code is 91323. 91323 described as mRNA COVID-19 vaccine intramuscular use. Then an additional code there is 90593. Chikungunya virus vaccine recombinant for intramuscular use. Already നമുക്ക് chikungunya virus vaccine live attenuated vaccine ഉണ്ടായിരുന്നു. ഇപ്പൊ അഡീഷണൽ ആയിട്ട് റീകോമ്പിനന്റ് ചിക്കൻഗുനിയ വൈറസ് വാക്സിന്റെ കൂടെ 90593 ആഡ് ആയിട്ടുണ്ട്. നെക്സ്റ്റ് ചേഞ്ച് ആപ്പണ്ട് 90631 ഇൻഫ്ലുവൻസ വൈറസ് വാക്സിൻ H5 പാൻഡമിക് ഫോർമുലേഷൻ split virus adjuvanted for intramuscular use. And another code also in under the influenza virus vaccine, that is influenza virus vaccine 90635 influenza virus vaccine H5N1 derived from cell cultures adjuvanted for intramuscular use. And another 2 new codes are also added in the vaccine section. That is a combination of influenza and COVID-19 vaccine. That may be trivalent or quadrivalent. First code is 90612. 612 described as combined influenza and COVID-19 vaccine trivalent. And 613 described as combined influenza and COVID-19 vaccine quadrivalent. These are all about the changes happened in the vaccine section. Next, move to the gastroenterology section. In gastroenterology, there is 2 older codes, 91120 and 91122. All are deleted and that replaced with the 2 new codes. First code is 91124. Rectal sensation, tone and compliance steady barostat. That is a code described 91124. Next code is added as 91125. Anorectal manometry with rectal sensation and rectal balloon expulsion test when performed. These are the 2 changes happened in the gastroenterology section. There is 2 codes are deleted and 2 codes are replaced instead of that. Next section under the ophthalmoscopy. Under the ophthalmoscopy, there is a new code 92288. Screening, dark adaptation measurement, road recovery intercept time with interpretation and report. There is already a code for diagnostic dark adaptation. Now a screening dark adaptation code is already added. Next, move to the otolaryngology section. The main changes happen in the medicine section, otolaryngology section. In otolaryngology section, hearing aid services. There is already 6 codes and 6 codes deleted. Instead, 12 codes are in section added. Let's move to the otolaryngology section. First new code is 92628. 92628. Evaluation of hearing aid candidacy. Hearing aid candidacy means hearing aid determination, unilateral or bilateral, including review and integration of audiological function test, assessment and interpretation of hearing needs, discussions of candidacy result, counseling on treatment options with report. And when performed, assessment of cognitive and communication status, first 30 minutes. The code describes as first 30 minutes, but time range is 16 to 37 minutes. And there is an add-on code 92629, each additional 50 minutes. Next new code is 92631, hearing aid selection service. Unilateral or bilateral, first 30 minutes, exact time is 16 to 37 minutes. And 92632 is the add-on code, each additional 50 minutes. Then new code 92634, hearing aid fitting service, unilateral or bilateral, first 60 minutes, but the exact time is 31 to 67 minutes. And there is an add-on code 92635, each additional 50 minutes. And there is another code 92636, hearing aid post-fitting follow-up service, unilateral or bilateral, first 30 minutes, exact time is 16 to 37 minutes. 92637, add-on code, each additional 50 minutes. These codes are the time-based codes. Then an additional new codes are 92638, behavioral verification of amplification, including aided threshold, functional gain, speech in voice when performed. These are no time-based code. And another new code is 92639, hearing aid measurement, verification with a probe microphone. And another new code is 92641, hearing device verification, electroacoustic analysis. And another new code is 92642, hearing assisted device, supplemental technology, fitting services. These codes are time based codes. Here a table is time range and describe in 2026 updation. Next, ഏറ്റവും കൂടുതൽ ചേഞ്ചസ് വന്നിരിക്കുന്ന കാർഡിയോവാസ്കുലർ സിസ്റ്റം ചാപ്റ്റർ പോലെ തന്നെ നമ്മുടെ മെഡിസിൻ സെക്ഷനിൽ വരുന്ന കാർഡിയോളജി സെക്ഷനിലും ഒരുപാട് ചേഞ്ചസ് ആണ്. Medicine section, cardiology section, main changes happened in the interventional cardiology. There's coronary therapeutic services, PCI section. First new code is 92930, percutaneous transcatheter placement of intracoronary stents with coronary angioplasty when performed. Single major coronary artery and or its branches and 2 or more distinct coronary lesions with 2 or more coronary stents deployed in 2 or more coronary segments or bifurcation lesion requiring angioplasty or stenting in both the main artery and side branches. Previously, PCI section 7 codes deleted, 2 codes added, 8 codes revised. PCI section major coronary arteries, coronary artery branches section. Additional coronary artery segments coronary artery segments recognized portion of major coronary artery or branch, like distal portion, middle portion, proximal portion. Okay, then there is an illustration describing the coronary artery segments in 2026 updates. Next new code is 92945, percutaneous transluminal revascularization, chronic total occlusion, single coronary artery or coronary artery branch or coronary artery bypass graft or subtended major coronary artery branches of bypass graft any combination of intracoronary stent, atherectomy, and angioplasty, combined antegrade and retrograde approach. Already നമുക്കുണ്ടായിരുന്ന 92943 എന്നുള്ള ഒരു കോഡ് റിവൈസ് ചെയ്ത് at last antegrade approach ആയിട്ടുണ്ട്. നെക്സ്റ്റ് കോഡാണ് 92945 combined antegrade and retrograde approach. Okay. Next section is implantable cardiovascular autonomic nervous system device evaluation. That is baroflex activation therapy modulation system. Mainly patient heart failure ഉള്ള patients അതുപോലെ resistant hypertension ഉള്ള patientsനെ യൂസ് ചെയ്യുന്ന ഒരു ഡിവൈസ് ആണ് ബാരോഫ്ലെക്സ് ആക്ടിവേഷൻ തെറാപ്പി മോഡുലേഷൻ സിസ്റ്റം ഡിവൈസ് എന്ന് പറയുന്നത്. ഓൾറെഡി നെർവസ് സിസ്റ്റം ചാപ്റ്ററിൽ ബാക്ക് ഡിവൈസിന്റെ ഇൻസേർഷൻ, റിമൂവൽ, റിവിഷന്റെ കോഡുകളൊക്കെ കണ്ടായിരുന്നു. ഇവിടെ വരുന്നത് ഈ ഡിവൈസിന്റെ ഇവാലുവേഷൻ ആണ്. അപ്പോൾ ഫസ്റ്റ് കോഡ് ഡിസ്ക്രൈബ് 93145 ഇൻട്രോഗ്രേഷൻ ഡിവൈസ് ഇവാലുവേഷൻ carotid sinus baroflex activation therapy modulation system, including telemetric iteratory communication with implantable device to monitor device diagnostic and programmed therapy values with interpretation and report without programming. Then NU code 93146 with programming including optimization, tolerated therapeutic level settings. There's ഒരു പുതിയതായിട്ട് മെഡിസിൻ സെക്ഷനിൽ വന്ന ഒരു സെക്ഷനാണ് ഇംപ്ലാന്റബിൾ കാർഡിയോവാട്ട് ഓട്ടോണമിക് നെർവസ് സിസ്റ്റം ഡിവൈസ് ഇവാലുവേഷൻ എന്ന് പറയാം. ഓക്കെ, നെക്സ്റ്റ് മൂവ് ടു ദ മെക്കാനിക്കൽ സ്കാൽപ് കൂളിംഗ് സർവീസ്. മെക്കാനിക്കൽ സ്കാൽപ് കൂളിംഗ് സർവീസ് മെയിൻലി യൂസ്ഡ് ഫോർ ദ കീമോതെറാപ്പി ഇൻഡ്യൂസ്ഡ് അലോപേഷ്യ. കീമോതെറാപ്പിയുടെ കോംപ്ലിക്കേഷൻ ആയിട്ട് വരുന്ന ഹെയർ ലോസ് പ്രിവെന്റ് ചെയ്യാനുള്ള ഒരു മെത്തേഡ് ആയിട്ടാണ് മെക്കാനിക്കൽ സ്കാൽപ് കൂളിംഗ് സർവീസ് വരുന്നത്. ഒരു ന്യൂ സെഷനാണ് ഇവിടെ വരുന്നത്. പേഷ്യന്റ് കീമോതെറാപ്പി ഇൻഫ്യൂഷൻ എടുക്കുന്ന പേഷ്യൻസിന് ഒരു ക്യാപ്പ് പ്ലേസ് ചെയ്യുക, മെക്കാനിക്കൽ സ്കാൽപ്പ് കൂൾ ചെയ്യാനുള്ള ഒരു ക്യാപ്പ് പ്ലേസ് ചെയ്യുകയാണ് ചെയ്യുന്നത്. ഇവിടെ 3 കോഡ്സ് ആണ് അഡീഷണൽ ആയിട്ട് ന്യൂ സെക്ഷനിൽ വന്നിരിക്കുന്നത്. 97007 മെക്കാനിക്കൽ സ്കാൽപ്പ് കൂളിംഗ് ഇൻക്ലൂഡിംഗ് ഇൻഡിവിജ്വൽ ക്യാപ്പ് സപ്ലൈ വിത്ത് ഹെഡ് മെഷർമെന്റ്, ഫിറ്റിംഗ് ആൻഡ് പേഷ്യന്റ് എഡ്യൂക്കേഷൻ. അതായത് മെഷർമെന്റ് എടുത്ത് പേഷ്യന്റിന് ആവശ്യമായിട്ടുള്ള ക്യാപ്പ് സപ്ലൈ ചെയ്യുന്നതുകൊണ്ടാണ് 97007 എന്ന് പറയുന്നത്. Next 97008 mechanical scalp cooling including hair preparation, individual cap placement, therapy initiation. ഈ മെത്തേഡ് അല്ലെങ്കിൽ തെറാപ്പീസ് ഇനീഷ്യേറ്റ് ചെയ്യുന്ന കോഡാണ് 97008 എന്ന് പറയുന്നത്. 008 ഡിസ്ക്രൈബ് ചെയ്യുന്ന ആൻഡ് പ്രീ കൂളിംഗ് പീരീഡ് എന്ന് പറയുന്നത്. അതായത് കീമോതെറാപ്പി ഇൻഫ്യൂഷൻ എടുക്കുന്ന ഒരു പേഷ്യന്റിന് 30 മിനിറ്റ്സ് ബിഫോർ ആയിട്ട് പേഷ്യന്റിന് ഈ മെക്കാനിക്കൽ സ്കാൽപ് കൂളിംഗ് ഡിവൈസ് ഹെഡിൽ പ്ലേസ് ചെയ്യും. ആൻഡ് ആഫ്റ്റർ ദാറ്റ് after chemotherapy infusion it will be removed. That is a 97008. That's add-on code 97009. That's provided after discontinuation of chemotherapy each 13 minutes. And after discontinuation, chemotherapy infusion discontinue ചെയ്തതിനു ശേഷം പേഷ്യന്റ് എത്ര ടൈം ഈ ക്യാപ്പ് പേഷ്യന്റെ ഹെഡിൽ വെക്കുന്നുണ്ട് അതിന്റെ ബേസിലുള്ള കോഡാണ് 97009. ഈച്ച് 30 മിനിറ്റ്സിനുള്ള കോഡാണ്. ഇവിടെ മിനിമം ടൈം ആയിട്ട് വരുന്നത് ലെസ് ദാൻ 60 മിനിറ്റ് ആണെങ്കിൽ അഡീഷണലി വന്നിരിക്കുകയാണെങ്കിൽ നമുക്ക് റിപ്പോർട്ട് ചെയ്യാൻ പാടില്ല. ഓക്കെ, നെക്സ്റ്റ് മൂവ് ടു ദ റിമോട്ട് തെറാപ്യൂട്ടിക് മോണിറ്ററിംഗ് സർവീസ്. ലൈക്ക് EATM section, there is a remote physiological monitoring service. There is many changes. Like here also, remote therapeutic monitoring service also a new code 98984. That describes as remote therapeutic monitoring device supply for data access or data transmission to support monitoring of respiratory system 2 to 15 days in a 30-day period. Already നമുക്കുണ്ടായിരുന്ന ഒരു കോഡ് എന്ന് പറയുന്നത് 98976 each 30 days എന്നായിരുന്നു ആ കോഡിന്റെ ഡിസ്ക്രിപ്ഷൻ വരുന്നത്. അതുപോലെ തന്നെ 98976 ലെസ് ദാൻ 60 ഡേയ്സ് ആണെങ്കിൽ കോഡ് ചെയ്യരുത് എന്നുള്ള ഒരു ഡിസ്ക്രിപ്ഷനും നമുക്ക് ഓൾറെഡി ഉണ്ടായിരുന്നു. ഇപ്പൊ ഒരു ന്യൂ കോഡ് വന്നു, അതായത് 2 to 15 days in a 13-day period. Respiratory system monitoring ആണ് 98984. There is another code is 98985 device supply for data access or data transmission to support monitoring of musculoskeletal system. Musculoskeletal system ഇതുപോലെ തന്നെ 2 to 15 days in a 13-day period ആണ് മോണിറ്റർ ചെയ്യുന്നതെങ്കിൽ 98985. And next code is 98986 device supply for data access or transmission to support monitoring of cognitive behavioral therapy. That's 2 to 15 days in a 30-day period. These are the new codes came under the remote therapeutic monitoring services. Next change happened under the remote therapeutic monitoring treatment management service. There is a new code added, that is 98979. Remote therapeutic monitoring treatment management services. Physician or qualified healthcare professional, time in a calendar month, requiring at least one real-time interactive communication with the patient or caregiver during a calendar month, first 10 minutes. There is already a code, that's 98980 in 2025, but the code describes as one interactive communication, not in real-time interactive communication, and that code describes as 20 minutes codes. And one new code came before that code, that is 98979. Here, one real-time interactive communication, and the code described by about first 10 minutes. These are new codes. These are the new codes came under the medicine section. Now move to the revised codes under the medicine section. First one is 90480. That is immunization administration by intramuscular injection, COVID-19. First or only component of each vaccine. Before that, we have 90480 for single dose COVID-19 administration. Now the two codes came, 90480 and 90481 for each additional component of COVID vaccine. Next code is 90620. Revised code is meningococcal recombinant protein and outer membrane vesicle vaccine. Serogroup for intramuscular use. That are revised. Then next code is 92284. Diagnostic dark adaptation examination, rod and cone sensitivities, rod cone breakpoint with interpretation and report. Before that, in this course, the bracket section is not there in 2025 section. Okay, then move to the PCI section, cardiology section. There's a code revision is 92920. Percutaneous transluminal coronary angioplasty PTCA, single major coronary artery and or its branches. Previously, there's a code for single major coronary artery or branch, and there is an add-on code is 92921. Now the add-on codes are deleted and the code replaced as 92920 replaced as single major coronary artery and or its branches. Like another code 92924. Here also this add-on code is removed for the 92924. First code 92924 described as percutaneous transluminal coronary atherectomy with coronary angioplasty when performed single major coronary artery and or its branches. Then same change happened in additional code 92928. The revision happened as percutaneous transcatheter placement of intracoronary stents with the coronary angioplasty when performed single major coronary artery or its branches and one lesion involving one or more coronary segment revised in this code. Next revision happened in 92933. Percutaneous transluminal coronary atherectomy with the intracoronary stent with the coronary angioplasty when performed single major coronary artery and or its branches when performed single major coronary artery and its branches. That is a change happened here. And another code is 92937. Percutaneous transluminal revascularization of coronary artery bypass graft. Any combination of intracoronary stent, atherectomy and angioplasty including distal portion, single coronary artery and or its branches. Next code is 92941. Percutaneous transluminal revascularization of acute, total or subtotal occlusion during acute myocardial infarction. Any combination of intracoronary stent, atherectomy and angioplasty including aspiration thrombectomy when performed single major coronary artery and or its branches or single bypass graft and or its subtended branches. Next revision in 92943 that describes as percutaneous transluminal revascularization of chronic total occlusion, single coronary artery branches or coronary artery bypass graft and or subtended major coronary artery branches of the bypass graft. Any combination of intracoronary stents, atherectomy and angioplasty, that's antegrade approach. There is a new code came under this section, antegrade and retrograde approach. Next revision is 92973. Percutaneous transluminal coronary mechanical aspiration thrombectomy. Before that, a mechanical thrombectomy, now revised to mechanical aspiration thrombectomy. There is an add-on code that revised 93571. Intravascular Doppler velocity and pressure derived coronary flow reserve measurement during coronary angiography, including pharmacological induced stress when performed initial vessel, and another add-on code is 93572 each additional vessel. These two codes descriptions are changed under the parenthesis. Next revision happened in the 98976. 98976 device supply for data access, data transmission to support monitoring of respiratory system. That's 16 to 30 days in a 30-day period. Before that, the code described each 13 days. Now it's changed to 16 to 30 days in a 30-day period. And another new revised code is 98977. Device supply for data access or data transmission to support monitoring of musculoskeletal system 16 to 30 days in a 30-day period. Before that, it's each 30 days. Next code is 98978. Device supply data access or data transmission to support monitoring of cognitive behavioral therapy 16 to 30 days in a 30-day period. And code revised is 98980. That's remote therapeutic monitoring services. There's a new code added before that, 98980. That's code described 10 minutes code. This 980 is changed to first 20 minutes, one real-time interaction section. And there is an add-on code 98981, each additional 20 minutes. These are all the revisions happened in the medicine section. Now moving to the deleted codes. In gastroenterology section, there's two codes are deleted, 91120 and 91122. And in otolaryngology section, hearing device services, 92590, 92591, 92592, 92593, and 92594 are deleted. In PCI section, interventional cardiology section, 92921, 92925, 92929, 92934, 92938, 92944, 92975, 92977. These codes are deleted. Then in pulmonary section, pulmonary diagnostic testing, rehabilitation and therapy section, there is a one code deleted, 94662. These are all about the medicine section. Next, move to the category 2 and 3 section. In category 2 and 3 section, there is 78 addition and 21 deletion and 4 revisions. Next, move to the category 3 new codes. There is an interrogation device evaluation. There is 3 new codes are added. Then move to the neurostimulator bladder dysfunction. There is 2 new codes are added. Middle ear hearing implant. There is 5 new codes are added. Then electroencephalography monitoring system. There is 5 new codes are added. Then jaw expansion oral prosthesis for obstructive sleep apnea. There is 3 new codes are added. Next, epicranial neurostimulator. There is 2 new codes are added. Next, in ablation breast tumor section, there is 2 new codes are added. Then the enzymatic debridement section, there is 3 new codes are added. Then the intravascular imaging of intra and extracranial section, there is 3 new codes are added. Then the code descriptor autologous muscle cell therapy, there is 3 new codes are added. Then continuous bilateral electroencephalography monitoring system, there is 7 new codes are added. Then the electronic analysis of implanted neurostimulator, there is 3 new codes are added. And the percutaneous tissue displacement, there is 5 new codes are added under the category 3 section. Okay, then move to the category 3 revised codes. In category 3 revised, first code is 02740. Code descriptor, percutaneous, laminotomy, burlaminectomy, cervical or thoracic. Then a revision happened under the 0598 and 05990 fluorescein wound imaging. And then revision happened in the 0600T ablation irreversible electroporation. These are the revisions came under the category 3 section. Next, the deletions came under the category 3 section. The deleted codes from the category 3 section moved and replaced as a category 1 section. First code is 0042T, cerebral perfusion analysis. Then deleted code is 0266T to 0273T, carotid sinus baroflex activation device. These codes are replaced under the category 1 codes under nervous system and medicine section. In 0275T, percutaneous laminotomy or laminectomy, and the deleted code is 03940, high dose rate electronic brachytherapy. Then deleted code is 0421T, transurethral water jet ablation of prostate. This came under the replaced under the category 1 section under the prostate section. Then code deleted 0623T to 0626T as a severity of coronary disease. 0619T cystourethropy with a transurethral anterior prostate. These deleted codes are moved to the category 1 section. Next, the code is 0631T transcutaneous visible light hyperspectral imaging. 0662T to 0663T scalp cooling mechanical. These codes are added under medicine section. Then 0720T percutaneous electrical nerve field stimulation. These are the changes happened in the category 3 section. These are all about the CPT updation. When we summarize in the CPT updation, main changes are happened under the value-based care, mainly the care management codes and behavioral health services codes, and also in digital medicine section, mainly the remote physiological monitoring and remote therapeutic monitoring section, and also under the preventive care section, mainly the cancer screening, counseling interventions, chronic disease detection, and preventive exams. And also main changes happened as a clinical AI, that is AI related codes created across the specialties, mainly radiology, pathology, cardiology, and ophthalmology section. These are all about the CPT 2026 updation. Thank you so much for your patience and your valuable time. Thank you.
Thank you so much, ma'am, for the presentation. So these are the updations regarding ICD and CPT that have came in 2026. If you have any doubts regarding the session, you can ask in the comment section. And for Arown students, you can directly connect with your teachers. And with that, we have reached the end of the session. Make sure to review the guidelines and apply in your work. Thanks for joining us today. Let's keep coding smarter. Thank you. Thank you so much.